The first item I have is a call to order that I will pass on over to the clerk. Madam Clerk.
Good morning. I am going to briefly review the rules and protocols for electronic participation in this regular council meeting. During these meetings, we continue to comply with provincial orders and public health orders and recommendations to support social distancing, as well as prohibiting public gatherings of more than 5 people. This meeting is being streamed live from the Region of Peel website, and we encourage the public to stay home in accordance with provincial and public health recommendations and listen to the proceedings from there. The people present in council chambers are Chair Yanika, myself, and clerks and IT staff sufficient to facilitate the technology and procedures for this meeting. We are conducting this meeting using Webex. If you are dialing in, please note that you will be required to identify yourself so we can update the system with your name. For an optimum Webex experience, we ask you to please take the following measures to avoid feedback and confusion with members speaking over one another. Please keep your microphones muted unless you have the floor to speak. Please use a headset and avoid using hands-free devices or speakers. Please speak loudly and clearly when you have the floor. Please ensure that any surrounding environmental noise, such as televisions, radios, and pets, is eliminated. The recommended Webex meeting display view is active speaker video view or active speaker and thumbnail video view, so that you will have a full view of the presentation slides and other meeting materials. During a presentation, we recommend that you close your participation list so you have a full view of the presentation slides. If you are experiencing a poor Wi-Fi connection, please disable your video. If you drop off the meeting, please rejoin, and if you have difficulties, please contact your local IT department first for assistance, following the same process as you do for local council meetings. As required, your local IT department will reach out to regional IT staff for further assistance. Thanks for the technical staff at the cities of Brampton and Mississauga and the town of Caledon who are standing by to provide assistance to the respective councillors. The video function for Webex has been activated, so you may choose to turn on your video. You can choose to leave it on throughout the meeting, or you can turn on your video only when you are speaking. If you don't want to activate the video feed, you are not required to do so. We will still hear you, just not see you. During staff presentations, the slides will be visible on your screens. If you are having difficulty viewing the slides, they were all provided to you in the revised agenda that was distributed on Tuesday. If you wish to speak, please click on the round participant icon at the bottom of your screen to enable your participant list. To indicate your request to speak, please raise your hand by clicking on the hand icon located to the right of your name in the participant list. Your hand icon will turn blue when engaged. Members who connect to the meeting via the dial-in option, please send an email to council@peelregion.ca and you will be added to the speakers list. When called upon, please unmute your microphone and proceed. When you have concluded your comment or question, please mute your microphone and lower your hand by pressing the then blue hand to the right of your name in the participant list. If you have any motions or amendments to introduce regarding today's agenda, please email your motion to council@peelregion.ca, identifying yourself as the mover and also identifying the seconder for your motion. If you do not have a seconder, the chair will call for one. Each motion will be read in its entirety prior to calling a vote. Voting will be conducted verbally. For procedural votes that do not require a recorded vote, I will call for any objections. If you have an objection, please unmute your microphone and indicate your name and objection. If no objections are stated, the motion will be deemed to be adopted. For recorded votes, I will call upon each member in alphabetical order based on last name. Once called upon, please unmute your microphone and indicate your yes or no vote. I will confirm the vote for each member. This process will take some time, so please have patience. If you do not respond when called upon to vote, I will call your name a second time. If you do not respond to the second call, you will be recorded as abstaining from the vote and your vote will count in the negative as a nay vote. If you are leaving the meeting, please send an email to council@peelregion.ca to indicate that you are leaving the meeting. If you have left the meeting for any votes thereafter, you will be marked absent. If you don't advise that you are leaving the meeting and you don't respond when called upon to vote, you will be considered to be abstaining, and a vote will be recorded in the negative as a nay vote. If the meeting should move into closed session, those members who are participating remotely must ensure that no other person is in the location from which you are taking part in the meeting, or make appropriate arrangements so that any other persons cannot see or hear any of the confidential deliberations taking place. If this is not possible, the member must withdraw from the meeting until it has moved back into public session. Prior to moving into a closed session, members shall declare that they adhere to the confidentiality standards as outlined in the Regional Council Code of Conduct. Members who leave the meeting during the in-camera session and attempt to connect back via the dial-in option will be required to send an email to council@peelregion.ca indicating their request to rejoin the meeting. We will temporarily pause the in-camera session and unlock the room to allow you to join. You will be required to identify yourself upon joining the meeting. If you have any questions as we proceed through the meeting, please send them to council@peelregion.ca together with the request to speak. We should now commence the meeting with roll call. Mayor Brown.
I'm here.
Thank you. Councillor Carlson.
I'm here too.
Thank you. Mayor Crombie.
I'm here, thank you.
Thank you. Councillor Demerla.
Here, thank you, present.
Thank you. Councillor Dasco.
I'm here, thank you.
Thank you. Councillor Dillon.
Here.
Thank you. Councillor Downey.
Present.
Thank you. Councillor Fonseca.
I'm here. Good morning.
Thank you. Councillor Fortini.
I'm here.
Thank you. Councillor Groves.
I'm here. Good morning.
Good morning. Councillor Innes.
Present.
Thank you. Councillor Kovac.
I'm here.
Thank you. Councillor Mahoney.
Present.
Thank you. Councillor McFadden.
Good morning. I'm present.
Thank you. Councillor Medeiros.
Here.
Thank you. Councillor Paleshi.
I'm here. Good morning.
Good morning. Councillor Parrish, we were advised by her EA that she has taken a fall and has fractured her ankle and is in the hospital. So we're sending her our best and we'll keep you posted. Councillor Raz.
Present.
Thank you. Councillor Sato.
Here.
Thank you. Councillor Santos. Councillor Santos. Councillor Sinclair.
Present.
Thank you. Councillor Starr.
Present.
Thank you. Mayor Thompson.
I'm here. Thank you.
Thank you. Councillor Vicente.
Present.
Thank you. All members present with the exception of Councillors Paris and Santos. Thank you.
Very good. Very
No,
good.
I'm here.
Sorry, who was it that we thought might not have been present, Madam Clerk, that we're acknowledging?
Councillor Santos is.
Councillor Santos, you're acknowledging that you're present?
I am here. Hello.
Okay,
Hello.
very
I'm
good.
here.
Thank you.
Okay, confirmed, and thank you. I don't want the opportunity to pass, though, first of all, to extend Councillor Parrish our well wishes, but also to let the good people of Malton and her constituency know these are unprecedented times, because I never, ever recall Carolyn having missed a meeting. She's a warhorse when it comes to attendance, and I think she should be acknowledged for that. So hope for a speedy recovery. Hope it's a minor issue, but her folks should otherwise know she's always present on behalf of her constituents. So get well soon, Carolyn. Thank you. Councillor Demerla, I have you on the list, but I was going to go to Indigenous. What is the matter? Does it relate to call to order or roll call?
Yes, it does refer to call to order. I just had a question. It's been something I've been meaning to ask. When we are present in the chamber, we have the ability to abstain from a vote. And when we abstain, that doesn't count as a no, right? It counts as an abstain. Am I right?
That's a very good point that I think should be re-emphasized. Madam Clerk?
An abstention counts as a nay or negative vote.
Even when you're in chamber?
That is correct. That's
So why do you have that option? I thought when you abstained, it would be recorded as an abstain, not as a no.
It is recorded as abstain, but it is counted as a negative.
Interesting. I didn't know that. Okay. All right. Thank you.
Thank you.
Thank you. Okay, thank you all. With that, our Indigenous land acknowledgement. We would like to begin by acknowledging that the land on which we gather and which the region of Peel operates is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land. In particular, we wish to acknowledge the territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is also home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have this opportunity to work on this land, and by so doing, give our respect to its first inhabitants. Okay, are there any declarations of conflict of interest? Hearing none, I go to the approval of the minutes. The minutes of May 14, 2020 Regional Council. Do I have a mover and a seconder, Madam Clerk?
Moved by
Raz can move.
Moved by Councillor Raz, seconded by Councillor Dasco. That the
Sorry,
meeting,
it's Councillor Downey. I had just sent in 2 pieces of correspondence to be added to the agenda. I just want to make sure that they're there.
that's for the motion for approval of agenda, which we'll get to in just a second.
Okay, thank you.
Thanks. So we have a motion to approve the May 14th, 2020 Regional Council meeting minutes, moved by Councillor Raz, seconded by Councillor Dasco. Do we hear any objections? Hearing no objections, carried. Thank you.
Very good. That brings us to item 5, approval of the agenda. Councillor Downey, did you have a matter?
Yes, through you, Chair. I just I sent clerks 2 letters from the federal government regarding long-term care. Just want to make sure that they're on our correspondence section.
Madam Clerk?
Thank you. We just received it. We will send it out to all councillors via email so that they'll have it in front of them when the item comes up on the agenda.
Thank you.
Thank you.
Seeing no one else on my list, Madam
Mr.
Clerk,
Chair,
why-
I have my hand.
Oh, sorry.
I have my hand raised, Mr. Chair.
Oh, I wasn't looking for your, I'm looking at my screen, but I'll have to look at the screen ahead of me
Oh.
for hands raised. My apologies, Councillor Stato. Please proceed.
That's okay. I'd like to add 2 items to the agenda. One would be a discussion on going ahead future council meetings. If we can have that discussion, please, at an appropriate time. And the second is a notice of motion not to discuss today, but to deal with at next week's council with regard to the request for an MZO that was sent by the town of Caledon. I did send the clerk a notice of motion, and I wasn't sure what the procedure would be today. We would prefer to deal with it next week at council. Councillor Parrish wished to speak to it as well, to allow her the opportunity to do so. So maybe if Catherine could just clarify how we would handle that. If we need to put it on the agenda today, or if my sending her the motion puts it on for next week. I just want to make sure that there's an opportunity to discuss.
Yes, Madam Clerk?
Thank you. And with regards to the second point with the notice of motion, I just checked my phone, and yes, I do see that you sent it to me a moment ago. We will add that to the agenda for distribution next Thursday, which will appear on the council agenda to be dealt with at the next regional council meeting on June 11th.
Okay, that's perfect. Thank you.
yeah.
So, Mr. Chair, then the only one I'm adding is just a brief discussion on the, on future council meetings. And I had asked Andrew if he could add to his presentation this morning an item with regard to allowing large bulk items at the CRCs, and he confirmed that he can do that today during his presentation.
As I can confirm as well. Yes, thank you. Moving on, carrying on with approval of the agenda, my next speaker, Councillor Groves.
No, I'm fine, Mr. Chair. Councillor Sato addressed it. Thank you.
Very good, Madam Clerk. Then a vote to you on the approval of the agenda.
We have a motion moved by Councillor Sato and seconded by Councillor Groves that the agenda for the May 28th, 2020 Regional Council meeting be approved and that the agenda include a letter from the federal government regarding long-term care homes in Ontario, and further that under other business, we discuss council meeting procedures. Hearing any objections? Hearing none, motion carries. Thank you.
Very good. Thank you all. That takes us to our consent agenda. We have the three presentations under COVID and also waste management 8123 that we will hear. Next item up, item 9.1, a communications matter from David C. Williams regarding amendments permitted to opening of some outdoor recreational amenities here for receipt. Do I have consent? Okay, no one wishes to hold. No items. Moving on to staff presentations 10.1, we will hear the presentation on the housing subsidy. No items related to health. No items related to human services. On to items related to planning and growth management. Item 15.1, new provincial policy statement. Here for information.
Wish to hold.
That is asked.
Councillor Sinclair, wish to hold.
Councillor Sinclair has asked for that to be held. 15.1, thank you. Moving on, item 17 related to enterprise program and services. 17.1, funding of capped tax increases for 2020. On consent, 17.2, statement of development charge reserve funds. On consent, 17.3, 2019 Annual Transparency and Accountable Government Report here for information. On consent, item 18.1 will require direction. That brings me to other business that we'll deal with then. The only thing I'll jump to is the in-camera only has the minutes from the last in-camera and a standard expropriation matter. Does anybody need to go in camera for either 24.1 or 24.2? Seeing no one, Madam Clerk, over to you to take the recorded vote on our consent agenda.
Thank you. That the following matters listed on the May 28th Regional Council agenda be approved under consent agenda, and it's all those matters with the exception of 10.1, 15.1, and 18.1. Moved by Councillor Sinclair and seconded by Councillor Starr. I'll call the vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
In support?
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes, in favor.
Councillor Dasco in favor. Councillor Dillon?
In favor.
Councillor Dillon in favor. Councillor Downey?
In favor?
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
Yes, in favor.
Councillor Fortini in favor. Councillor Groves?
Yes, in favor.
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Thank you. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish? Oh, sorry. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes, in favor.
Councillor Santos in favor. Councillor Sinclair?
In favor?
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. It carries. Thank you.
Thank you. With that, we're on to no delegations. Item 8, COVID-19 related matters and presentations from staff. Item 8.1, update on demobilization and recovery planning. An oral presentation by Nancy Polzinelli, Interim Chief Administrative Officer. Nancy.
Thank you. Good morning, Chair Yanika and members of Council. This week marks week 11 of our regional emergency response. And as you know, this journey has been even longer for our public health team. This morning, I will share an update on our planning for the eventual demobilization of activities we have put in place to support our response to COVID-19. I will also outline planning for the recovery of activities the region has paused, modified, or reduced when emergency response became the priority. As you know, the province has initiated the first phase of its recovery plan. Some municipalities in Ontario have begun to follow suit, reopening their doors and bringing services back online. Peel is not ready yet. To exemplify this, I would like to paint a picture for you. I'm going to take you back to March 28th. 2 months ago, we had 199 positive cases and 0 deaths in Peel. We were 2 weeks into the response. We had launched our Regional Emergency Operations Center with expanded membership from municipal partners. We were rapidly implementing new measures every day to reduce risks of community spread and strengthening our response efforts. And this included supporting staff to work remotely, scaling back some frontline and non-essential services, and finding new ways to connect with and support our community. At that time, residents were fearful. Parents were still coming to terms with the announcement of extended school closures, and toilet paper and hand sanitizers were very precious items to come by. A month later, on April 28th, Peel reported 2,457 positive cases and 89 deaths. It was actually 3 more deaths than the day before. At this point, we had implemented active screening at all our regional sites, coordinated PPE inventory within our organization and with our hospital and municipal partners across Peel. We launched a temporary isolation housing program for select essential frontline workers. And we strengthened our collaboration with our community and municipal partners to provide an integrated and timely community response. Residents were remaining vigilant and were growing accustomed to lines in the grocery store, physical distancing, frequent hand washing, and balancing work and family needs with staying home. Now we fast forward another month. Now, this is data extracted from yesterday. We are reporting 4,308 positive cases and 268 deaths, 8 more from the day before. People have become familiar with such numbers, but we can't allow complacency to set in. The region implemented a comprehensive pandemic response based on the evidence showing increasing risk of community transmission. The numbers today tell us that as well, and Dr. Lowe will provide further details shortly in his update to Council around new data sources and indicators that we have begun to track here in Peel. Ongoing community transmission means that any resumption of activities must be taken slowly and carefully. We will continue to base our planning on evidence and the advice of our public health experts. And as a municipal organization, we must lead by example. So with this in mind, it is prudent to prepare for demobilization and recovery, and we are. When the numbers tell us it is time, we will be ready to implement those plans. Slide 2. Until then, the region's crisis response is fully operating. In the community, we continue to work with our partners to identify and address urgent needs through collaborative tables and ongoing partnership. In recent council meetings, I have outlined our community-focused work, such as with the development of the community response table. Internally, our response has been bolstered by the incredible talented skills and passion of over 800 staff who have been redeployed to new roles to support essential services and COVID-related programs. So some examples include 100 staff working across our 5 long-term care homes, supporting our teams with active screening, PPE management, dietary and housekeeping supports. 500 public health staff who have shifted roles to support the pandemic response, and many in case and contact. 75 paramedics have been trained for swabbing that have administered over 8,000 tests in congregate settings across Peel. And that doesn't include the dental hygienists from public health that have done the same. And 13 staff that have been supporting essential frontline workers to effectively self-isolate through temporary housing accommodation. As our response is continuing, our demobilization and recovery planning is progressing well under the guidance of an internal task force. We are very much taking a peel-based approach and will be carefully guided by the expertise and advice of our interim medical officer of health. Slide 3. The slide before you outlines the phases of our evolving planning framework. It's depicted in a linear fashion, but this approach is describing how implementation must in fact be adaptable. You've heard this analogy. Think of it as a dimmer switch. We must be able to quickly scale up or down to respond to the risk within our community and react to the data and information shared by public health. This means until we hear otherwise, we remain in the planning phases. And in those planning phases, this is, a feel of what we're looking for. We look to what needs to be reopened in each phase. So what needs to be reopened in each phase? Why these services need to come online in that phase, and the implications of recalling staff who are currently redeployed to COVID response. We are also planning for how we do this, being mindful of how we use our office spaces or not, how we will best support our staff to be successful in adapting roles, and how we can and should transform our services to ensure we are meeting and evolving our needs of the community. Staying with this dimmer switch analogy, when it comes time to turn on the lights a little bit more, our hand is still on the switch, ready to return to the previous setting if needed. Reopening must also be coordinated with our municipal partners, given the interdependencies of many of our services and our common focus on the well-being of the residents of Peel. And throughout it all, we will be focused on innovation, transformation, fiscal responsibility, and future-proofing. This is about ensuring Peel learns from this experience and is in a better place of readiness for any future crisis. Slide 4. Planning is happening across all services, commencing with considerations that enable frontline service delivery that are critical to this work. This planning for enabling features are organized around 4 areas. Facilities is about making sure the use and design and maintenance of these spaces make sense in the pandemic and recovery worlds, including issues related to physical distancing, appropriate cleaning, and disinfecting practices. Our digital team is focused on evolving and developing information technology practices and policies. Digital builds on this work, enabling physical distancing by using online tools and infrastructure, including supporting service innovation and transformation. Our human resources focus will develop equitable procedures for redeploying staff or redeployed staff to return to their homes, their home positions, and health and safety measures that will ensure that staff and clients are properly equipped and feel safe when they are at work or accessing essential services at the region. Finally, we are keenly focused on communicating, involving, and informing staff and residents with key information related to changes in service delivery and our new realities at each stage of recovery. Slide 5. The executive leadership team will be reviewing the plans and recommendations developed by the Demobilization and Recovery Task Force and preparing a report back to Council in the coming month. As I said in my opening, completing of the plan does not necessarily mean implementation. We are taking an evidence-based Peel approach on consultation and advice from our medical officer of health. And as always, throughout our recovery planning journey, my commitment to Council and to the community is to provide timely updates as we continue building a community for life in Peel. Next slide. Thank you, and the executive team and I are happy to take any questions.
Thank you, Nancy. And I do have a list, but at this time, just to be clear, Madam Clerk and I agree that the items that Councillor Downey referred to, the correspondence, will be before you at this time as well. And Madam Clerk, just so you can be clear on what those two items are.
The items from Councillor Downey are two letters that were forwarded to Prime Minister Trudeau and Minister Haddu and to Premier Ford in relation to long-term care and investigation into an inquiry into long-term care. So they are emailed to you, and they would be for receipt. I believe Councillor Santos also wants to speak.
And she is first on my list. Councillor Santos.
Thank you very much, and through you, Chair, thank you, Nancy, for your presentation today, and Councillor Downey for bringing forward the correspondence from the federal government. The other piece of new evidence that we received, as everybody knows, is the very scathing report from the Canadian Armed Forces regarding the state of our long-term care facilities. One of them noted in the report is in the city of Brampton. And I know that many of my colleagues around the table have a lot to say about this particular issue. So I'm just going to bring forward the motion now for everyone to look at. It's essentially just being in support for what the federal government is calling for in that letter, but also to continue to advocate for resources to enhance care in long-term care homes in general. So it's just a letter that we're asking the chair to put forward to support what the federal government is calling for in terms of a public inquiry, as well as continuing to advocate for resources to enhance care in long-term care homes. I think the report itself was very disturbing, incredibly troubling, and I do understand that this has been something that's been going on for a long period of time beyond this current provincial government's seat at the table right now. So I'm hoping that folks around the table will support it. Thank you.
Councillor Santos, thank you. Madam Clerk, can you be clear on that motion?
Thank you, Chair Yanika. A motion to come out of correspondence requires 2/3 vote to deal with today. So I would suggest that we have a vote to determine if this motion could be heard today, and then put the motion on the floor for debate and discussion thereafter.
Madam Clerk, I think that is the most appropriate way to proceed. Would you like to read? She's explained it well, but can you be clear on the couple of sentences that you have before you?
The actual motion itself, moved by Councillor Santos, seconded by Mayor Thompson, that the regional chair send a letter on behalf of Regional Council to the Premier of Ontario and the Minister of Long-Term Care to convey Regional Council's support for a provincial inquiry into long-term care in Ontario.
Very good. And what I'm going to do, Madam Clerk and Council, is I'm going to carry on with the conversation. Then coming out of the conversation, we will come back to this subject if it is still before us.
The 2/3 vote to discuss the motion?
If they're speaking, perhaps that's probably better because some people might wish to speak to it. So, Madam Clerk, back over to you then. Do we have 2/3 consent to deal with this motion that's just been presented to us? Madam Clerk, if you can conduct the vote.
I'll call a 2/3 vote then. This is the vote to that the procedure bylaw be waived in order to permit the consideration of the motion related to an item of correspondence, which is the motion that I just read. 2/3 is required. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
In favor.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor
In
Fonseca
favor.
in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sado?
Yes.
Councillor Sado in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente, it's unanimous so that we can discuss the motion. And I do understand that the motion has got a slight amendment to it. So if, with your permission, I'll reread it.
Please do.
That the regional chair send a letter on behalf of regional council to the Premier of Ontario and the Minister of Long-Term Care to convey regional council's support for a provincial inquiry into long-term care in Ontario, and that the regional PL continue to advocate for resources to enhance care in long-term care homes.
Thank you. You have Nancy's presentation and the motion before you. I go to my list. Councillor Sinclair, Downey, and Mayor Brown. Councillor Sinclair.
Yes, I noticed the presentation by the CAO stressing evidence-based, and I wondered where we are on the test, trace, and isolate program. Who's in control of that program, and what are our capacity to test?
Nancy, through to you perhaps, and our medical officer of health.
Yes, I was through the chair. Thank you for that question, Councillor Sinclair. And I was actually going to say that this is a fabulous question that should go to Dr. Lowe. I'm not certain if you'd like him to respond right now or when he presents, but he will certainly be able to speak to that very clearly, very well.
Very well. Wait for Dr. Lowe then. Thank you.
Thank you. Councillor Downey.
Thank you, through you, Chair, to Nancy, or potentially to Commissioner of Health. Just regarding the motion, the Armed Forces report identified numerous issues in LTC homes. As an operator, the region being an operator of 5 homes, what do you think the underlying root causes of those issues are? I think that COVID has kind of pulled a layer off for all of us. And I know, having visited all of the homes in Peel, that we do an exceptional job and our staff work diligently to care for our residents in Peel. But you know, obviously that was not the case in many of them were investigated. So I'm just wondering if you could maybe give us some ideas about what you think the root causes of those issues are. I can guess to many of them, but I'd like to hear it from staff.
Thank you. Through the chair, I will start this response and then certainly pass it to Commissioner Granger, who will be able to give some full details. This is a great opportunity for me to share with Council that just yesterday, through an invitation by MP Sidhu, I presented to the House of Commons Standing Committee on Health. And while my topic spoke to a number of our programs that we've put in place for the community under COVID, this topic was certainly one of the highlights for that meeting. And I'm happy to say that it was a great opportunity for me to share our council endorsed advocacy around long-term care, all of which umbrellas under our butterfly model or emotional-based person-centered care, because part of the root of many of these issues is just that. So on that note, I would like to pass it to Commissioner Granger, and she'll provide more detail.
Through you, Mr. Chair, thank you, Councillor Downey, for the question, and thank you, CAO Paul Sinelli, for starting us off. So I'll just continue on. We are equally concerned about the findings in the report. As you know, how much we care for the people living in our homes. COVID-19 has exposed various issues in long-term care. There are things like staffing ratios, funding, increased complexity of resident needs, and the way our homes are built that are part of the ongoing discussion about the change that's needed in our long-term care sector. These are very important and necessary. However, there's also cultural issues that are at the core of how we approach our long-term care that I'd like to highlight. As we've brought before you regarding our butterfly presentations, long-term care has become inherently task-based. Staff are trying to rush to feed, document, look after one resident after another on a strict schedule. The issue is that we approach long-term care like a set of tasks, a checklist that we make the person's needs secondary to completing the tasks. And in many cases, it becomes fear-based care and not emotional care. While we've brought before you the discussion of person-centered care many times, at its core, it does offer solutions to where we want to go. Creating a culture that enables staff to understand and meet the needs of each unique person, both physically, emotionally, can improve well-being and avoid problems before they arise. Enabling true person-centered care isn't easy, particularly in our current context with this pandemic. However, our learnings from Butterfly implementation and your support of this work has been invaluable to our overall response to how we're dealing with COVID. So overall, what I feel that the sector needs and what we will be advocating for is better staffing ratios, so our staff have more time getting to know those in their care and meeting their individual needs, which you have supported. We also need regulations that are less focused on just documentation and the completion of tasks, but more focused on measuring emotional care. And it isn't just about regular inspections, as I think you've heard. We also need more training programs and funding to support them so that staff can better understand the complex conditions like dementia and how to meet individual needs. We also need better building standards and retrofit programs to create smaller, more intimate and positive spaces that promote engagement. We need to stop building institutions and start building homes. This will support infection prevention and control, which is difficult in larger homes where 30 to 40 people share one space. Our new Seniors Health and Wellness Village at Peel Manor, which you have supported, will be a shining example of how a home should be built. Sadly, we have still not been able to access provincial funding for this project, but we continue to work on that. We also need to promote and welcome family and community involvement, as these people can be a core part of the care team and support engagement and connection. And lastly, the focus of this review and change cannot sit solely with long-term care. We have to ensure long-term care reflects its role in the overall continuum of care for our seniors, which we are doing through our seniors term of council priority. Thank you.
Thank you, Commissioner Granger. I think that I have conversations with Kathy during the week, checking in on a lot of these issues, and as the chair of health, I think it's important for all of my colleagues around the table to know and understand that as an operator in Peel, we have fantastic staff, and we also, through COVID, have the ability to fill those staffing gaps, unlike our private sector partners. So it was made clear to me when Kathy said, if our staff are gone or they're sick, our senior management could be in the homes caring for our seniors. And also you touched on one other thing that I think is also really important. It's important to look at the things that don't cost money when we're talking about our staff and the way that we operate our homes. And I think that the province, through an inquiry, could take a page out of Peel's book. Kathy told me a story about a number of staff that wheeled a resident in their entire bed out of the long-term care facility this week so that their family members could be with them in their last moment. And I think that it's really important that we remember that our staff are doing great work and they're leading the way. And I thank you all for that.
Thank you. Mayor Brown.
Yeah, on the motion that Councillor Downey and Santos were talking about in terms of long-term care, I'm glad that you flagged that from the correspondence with MP Sidhu. I really believe that during this pandemic, one of the areas that we're going to be judged negatively on is the treatment of our most vulnerable citizens. When we heard of problems, we thought they were in someone else's backyard. The reality is you look at that Canadian Forces report and we're not immune to that criticism. I realize this is provincially regulated, but we've always tried to be on the right side of issues. And there is momentum right now for an inquiry. There is momentum for greater attention to how we treat our senior citizens. And so I'm glad that you have raised this. Reading that report about the same PPE being used and not changed, no wonder it spread. No wonder they describe long-term care settings as a tinderbox for the spread of the virus. Reading the report that said that they left food in residents' mouth as they were going to sleep, where they could choke. It just makes your stomach churn. And so I think we should join the chorus of advocacy right now, asking for an inquiry as soon as possible. I don't think this pandemic is going to be over anytime soon. And so I know an inquiry is really stage 2 about how to learn from the mistakes that have happened. But if there's anything we can learn more immediately, that will be helpful for the residents that are still in the heat of it in our long-term care settings. And I know a lot of the outbreaks have dissipated, but if we have a second wave, they're going to come back. If we have a second wave in the fall, we're going to be under the gun again in this setting. And if we failed the public on this, that's something that I think we're all going to be deeply disappointed in. And so everyone has a loved one in a long-term care setting. My family's no exception. And let's join the advocacy on putting a greater light on this.
Thank you, Councillor Demerla.
Thank you, Chair. I just want to say, like many of you, I also read the report from the armed forces. That was quite very disturbing. But I did want to say 2 things. One is I want to give a shout out to, notwithstanding what we read in the report, I know that there are many dedicated workers in the long-term care sector, including in Peel, some of our own municipally run ones, and across the province that are doing great work, really care for the residents, really love the residents. And I just want to give a shout out to them, because I know that we're seeing one side of it and it's very, very disturbing, but I do want to make sure we acknowledge that there's literally thousands of nurses and PSWs across this province who under very difficult circumstances are doing the best they can for their residents. I wanted to acknowledge that. I've seen that firsthand in my previous role. The second thing I wanted to say is that while I fully support a government inquiry or a provincial inquiry, the fact is we know we've had so many investigations, so many white papers. We know what the problems are. We really need to be acting. And I'm sure there's more stuff that might come out because of COVID through a government inquiry. But I think there's good people in this province who are well aware of what the fixes are. And we need to be really advocating for fixes really quickly, not wait for the government inquiry, which can, even if it started tomorrow, it would take time, but there are some fixes that need to be made. The commissioner made a very, very astute observation, which is at the heart of it all, which is we have to move to an outcomes-based model in terms of how we look at our long-term care homes. The government and all, this is not a partisan comment, we have been very prescriptive. If you look at the Long-Term Care Act, it is so prescriptive down to, how you care for the glasses, whether the glasses are kept on a drawer or not kept on a drawer. I mean, it is very prescriptive, and there's a bit of a gotcha in it, and we need to move towards an outcomes-based model. I mean, I've heard so many small long-term care operators come and say, they ask us to write how many times we've changed the bed sheet or whatever, and some of the smaller operators just can't cope with it. So we know what the fixes are to some extent, and I wish and if we can amend the motion to recognize that even as we wait for the inquiry, perhaps if we can put into the motion that the government not wait but start looking at fixes immediately. If the movers and the seconder of the motion are open to that, then I'd ask the clerk to put that in as well. Thank you.
Thank you, Councillor Groves.
Thank you, Chair. And again, I agree with the previous speakers. The report was actually quite disturbing. But I can tell you that my mom is in a long-term care home. And I know that the staff in that particular home are doing everything they possibly can to work with these residents. And it isn't easy on the staff either. And I also know that because of this pandemic, there are more responsibilities that the staff have, and because they have to now check temperatures and vitals every hour on the hour. We've got residents that are in there, including my mom, who is very frustrated because we're not able to see her. She's not able to see us, and that goes for all the residents there. So the residents are also struggling with these emotional issues, and that's contributing to a lot of these. And they are putting extra demands on the staff that are in the home. And I also want to give a shout out to our staff in our long-term care homes, because I think they are doing a fabulous job. We also need to recognize that all those staff, they're going in, they are also putting their lives and their families' lives at risk, caring for our loved ones. I agree with Councillor Demerla. An inquiry takes a long time. Right now, we have an issue and we really need to address the issue, and we need to have the province provide whatever it is that we need. We've been advocating for funding for many, many years in Peel Region, and here we are, we're in COVID-19, and it's just become worse. One of the things that Commissioner Granger said, and I think that that's a huge part of it too, the solution is not building institutions, but building homes. We need to recognize that the folks who are the residents in these long-term care facilities, this is their home. And I know that having it more of a home type environment as opposed to institution, especially in challenging times like this, it does help with those residents feeling more at ease. So there are a number of things. And like I said, I think a big part of it is all the additional rules and regulations and guidelines that are placed on the workers in the homes, that they have to now do extra work, monitoring very closely. Sometimes some residents have to go into isolation. And I can tell you, for example, my mother, she goes to the hospital 3 times a week for dialysis. And because of that, she's in isolation. That also becomes a huge problem and a real emotional problem for her as well. And there are many residents, other residents, who are in the same boat. So it's a really complex situation. It's just not cut and dry. It's not one solution. I mean, I was saddened to read that where they're talking about where food is left in the resident's mouth and they're not being fed properly, or maybe they're not being changed properly. And I know that with bathing and that, they're not allowed to do that right now because they can't use the communal showers and that. So it's just a very tough it's a very tough situation. But I know that the folks here, our staff in Peel Region, and I can tell you the ones in the home that my mom is in, they are doing the best they can under some very tough circumstances. So happy to support the motion, but I agree we need to advocate for some fixes immediately. Thank you.
Thank you, Commissioner Commissioner Granger, on some of the points Councillor Groves has raised.
Through you, Mr. Chair, yes, thank you very much. I really do echo your comments, and Councillor Demerler's as well. One thing I did want to bring forward is that we have put our names, the Region of Peel names, forward as already to participate on the provincial commission, because they were already looking for names. So we have put our resumes forward to be able to participate, both our dementia advisor and Dr. Saha and my director of long-term care. So we're very hopeful that we have sat on other provincial tables, so we're hopeful that they will accept us to be part of this, because we do have some good evidence to demonstrate what makes a good home. So thank you very much for your comments and your support.
Thank you. Mayor Thompson.
Thank you. My question is, it's my pleasure to second this. I think it's extremely important going forward. Councillor Demerla did say we need action to move forward and put things into place. Since my mother-in-law was in long-term care before she passed, the staff were phenomenal. I can't say enough of the Peel systems and the private homes. A lot of them are well run, but we've got some challenges, especially the older. But one thing I'm going to say is it's their home. I agree, but I think we have to look at it through a hospital lens, the patient-centric first, because they are needing special care. That's why they're there. And it's about taking care of the patient versus cutting costs, and we can't afford it, so our time's up. We're not going to spend any more time with this person. I know Peel isn't that way, but I know that's where some of the problem is the private, if you read through what the military report is about. So I think also that that's something that we have to look at, and I think I'm glad Peel's part of the solution, but I really think we need to engage the hospitals, and I gained a lot through the COVID meetings, partnering with the hospitals and hearing what they have to say. They're the way they look through their lens. I am impressed in how they do it, and I think this is what we need to be doing with the long-term care as well. And maybe Kathy might have, or the commissioner might have something to say about that, but I'm just saying, reaching out, I think going forward, that's what I think we need to look at. Thank you.
Thank you. Go ahead. Yes, please.
Through you, Mr. Chair. Thank you, Mayor Thompson, for the comments. Yes, as we've brought forward our council reports on the butterfly, I echo your comments. We do need to create homes that are person-centered and emotional-based, but it does go hand in hand with ensuring that there is good clinical care. Which is why we do partner with the hospitals on a regular basis, which is why we brought on Dr. Saha about 3 years ago to ensure that we also focus on the clinical care. But what we've always said is you do not have to provide good clinical care without thinking about the emotional care as well. So I think it's a good balance, and it is. But I do want to echo some of the previous comments that we can continue to provide good clinical care, but it can still be someone's home. So we do believe that, and that's what we're working to achieve in Peel and across the province. Thank you.
Thank you. Mayor Crombie.
Thank you, Mr. Chair, and thank you, Commissioner Granger, for your comments, and to Councillor Demerla, whose wisdom and advice I always listen to, as she was a former Minister for Seniors. So, Councillor Demerla, I want to thank you as well for your perspective. It has helped frame it very well. I think we all agree that the report from the armed forces showed deplorable conditions in many cases, and I found it not only saddening but sickening. My grandmother lived in the Eatonville home in the 90s, and she always begged us to take her home with her. She didn't want to stay, but we weren't able to care for her because she had advanced dementia. But it was heartbreaking to leave her there. And we can see that it was one of the hot spots today. And I want to thank the Premier for setting up the independent commission to investigate. I think we need all the help we can get, and he has established a framework. So I think we work with this independent commission, to Mayor Brown's point, an inquiry. I understand that would take too long. This is already rolling, so I'm happy to support the current framework. I think that what we really need to establish is to review all the care practices of not only our long-term care homes, but the privately owned long-term care homes as well, and whatever assistance the provincial government can provide, and the resources as well. What we want to ensure is that our seniors, our grandparents, our parents can live in dignity, in safety, and in a healthy environment. And certainly I think that if there's any outcome of COVID, this pandemic, it will be that we will care for our beloved seniors differently in the future. I would be very interested in knowing if we've analyzed the differences between the public and the private homes, and if there are underlying differences in the treatments or care. As Councillor Downey asked right to begin with, what were some of those differences, underlying differences? And I don't really feel that that was fully explained. And I don't know if they were funding issues or treatment protocol issues that differed. It would be very interesting, and I don't know if Dr. Lowe has a perspective on the issue, that it does seem that seniors who live in public long-term care homes fared better in this pandemic than those in the private homes. And I don't know if anyone wants to venture an opinion or if anyone has any facts or if that is something that will be debated and discussed and analyzed during the commission, during the task force. But certainly if Commissioner Granger or Dr. Lowe want to comment, I would be very eager to hear their perspective. I do realize that there are a number of class action lawsuits that have been filed. So I guess we will all tread lightly on our comments, but it would be interesting to analyze the differences in care and the outcomes and whether one system fared better than the next. But nonetheless, I think we all agree that the system has to change going forward. Thank you.
Thank you. Commissioner Granger, did you wish to speak to that?
Sure, through you, Mr. Chair. Thank you, Mayor Cranby, for your comments. I'm happy to try and venture an answer. Yes, well, it's difficult to make generalizations between private homes versus regional homes, as many in the sector, and both in private and municipal, have been focused on improving care while still struggling with some of the same issues, such as working in older homes and difficulty in hiring staff, which have become particularly evident during this COVID-19. It's hit all of us very hard. But as Councillor Downey highlighted, we're fortunate in our regional homes that we have staff across the region who were able to be redeployed to support our emergency. We also had staff from our adult day centers as they were closed, so they were able to help support our homes as well. I'm sure I am bringing back a report on June 11th to discuss long-term care in more detail. Not all of the information and indicators about care in different homes are accessible to all of us, but I'm sure that through this inquiry and through the commission, they will be looking at all of those pieces that you've discussed. It also supports, as I mentioned previously, that we have made seniors a term of council priority, and we have a very supportive community and council who have given us the resources to ensure we provide, butterfly and other programs within our homes. So yes, and we do discuss these issues at Advantage, which is our provincial advocacy body for municipal and nonprofit homes. So we will continue to look into what's needed overall across the sector.
Thank you for that. If I may just add that
sure.
Certainly we redeployed staff to assist in our long-term care homes, and that's wonderful. But one of the Mississauga homes, Camilla Care, were provided additional staffing through Trillium Health Partners, and they did their best as well to come in and supplement the care that was there. But obviously an older model home, architecturally different, as Councillor DeMerla will attest to, many ward homes. So ward rooms, so 4 people in a room, not conducive to isolation and separation in times of a pandemic. So needless to say, we saw the pandemic with the case counts very high in that home, since they were not able to isolate in a way that many other newer homes could. So those are some of the factors I think that are in play and why some homes fared better than others, notwithstanding, of course, the staff are so dedicated and worked off their feet, and we applaud them each and every day. It's not the commitment of the staff, but they're maybe understaffed. Sorry, I didn't know if you were speaking. Nope. And I just wondered if Dr. Lowe is on the call and if he wanted to venture about outcomes, if there's been any analysis in the public versus private homes yet, or will that be to come?
Mayor Crombie, what I'm going to suggest is we'll hold that, because he's our next deputant, and perhaps he might kick off with that. And quite rightly put.
Thank you.
Carrying on with my list, I have Ines Sinclair DeMerla. Councillor Ines.
Thank you. And just to follow up on what Councillor DeMerla has stated, that I fully support the public inquiry. I think that we need an independent review and to look at it and to remember that these are our most vulnerable residents. But to the point that everybody has been saying, that doesn't deal with the immediate issue. And what Councillor DeMerlo is saying is that there still is an immediate issue that's taking place, and that some actions need to be taken and that support needs to be given. So while we continue to advocate for additional resources, I think that we also have to advocate for our residents that are living in those homes at this moment to ensure that they are getting the adequate care that they require. So in in that, in the one letter to the Premier, there is a series of recommendations that they are asking for to deal with the immediate response and care for those residents. So I don't know if Councillor Demerla wanted to perhaps make an amendment to support those in the motion as well, given that it was her that was speaking with regards to ensuring that we provide immediate care. But I think that is something that we need to address because the issue is ongoing. And as Mayor Crombie has stated, whether it's a provincial requirement or a commission, it's going to take time. And it's going to take time to do the review. It's going to take time to make a decision and then to implement them. So I think that in particular, the case of the home in Brampton, while it's private, they are still our residents. And we do owe a responsibility to ensure that their safety and well-being is utmost. So I would suggest that perhaps an amendment be made, but I will leave that to Councillor Demerla because I know she's next on to speak.
Yeah, and the clerk has suggested perhaps, Councillor Demerla, before I come to you, the clerk can read what is exactly before her at this time. Madam Clerk?
This is the motion in its entirety with the amendment as requested from Councillor Demerla as a friendly amendment that Councillor Santos and Thompson as the mover and seconder would need to agree to. The full motion that the regional chair send a letter on behalf of regional council to the Premier of Ontario and the Minister of Long-Term Care to convey regional council's support for a provincial inquiry into long-term care in Ontario. And further, that the Region of Peel continue to advocate for immediate action and resources to enhance person-centered care in long-term care homes.
Councillor Demerla.
Thank you, Chair. I think the amendment does get that point. I might just add a line that says move to address known gaps. I mean, we know what the problems are, so maybe it would just be a little bit stronger if you could add those words, but otherwise it's fine. I did want to address one thing, which is the issue between for-profit and not-for-profit. I know that has come up quite a bit, but I just want to make the point that although in this pandemic, it's quite clear that the for-profits are the ones that have shown largely where the gaps are, and perhaps one of them among the more disturbing stories. That said, there's a number of for-profit homes that do quite well. In the past, there have been many, many studies that have shown that on average, there's a lot of very good for-profit homes and some not so good for-profit homes, and there's some very good not-for-profit homes, but also there are some not so good not-for-profit homes. So we want to be careful that we don't throw the baby out with the bathwater, or we start to, we really need to wait for full evidence before we sort of make a simplistic division of for-profit versus not-for-profit. I have to say that 60% of the homes in Ontario are for-profit. And so, the idea that somehow we can just move to a completely not-for-profit model right away is not practical. We just have to work with the system we have and not be too simplistic and recognize that there's weaknesses across the board. That said, I do recognize that some of the worst egregious issues have come up in some of the for-profit homes. But I do want to say one thing, which I'm trying to figure out, and maybe Dr. Lowe can shed some light, is that Sienna runs two homes in my ward, not in my ward, but in Mississauga. One is Camilla Care, which has had horrible, horrible outcomes. But they also run another one where last week at least, they had 0 COVID cases. So it's the same operator. So just makes the point that let's not be too simplistic on this issue. Thank you.
Thank you. That exhausts my list, but I would, if I could, as chair, just one quick comment, and Councillor Demerla has given me a marvelous segue, and I'm not going to talk about seniors right now because it's just been so painful having to hear what we've heard this last week, but I'm going to give you an anecdote that what I think quite clearly speaks to the challenge, and it was years ago as a young councillor when the housing issue and people that weren't being homed was a big issue to me, so I thought I'd turn my mind and my attention to it. And I remember looking at the Peel waiting list at the time for affordable housing, assisted housing. The waiting list was somewhere between 15 and 17,000 people, and I did the analysis that said if we took every dollar that we paid in taxes at the city of Mississauga and at the region of Peel and started building homes, we wouldn't catch up in 17 years. That means, of course, you don't have a fire department anymore. That means you don't have a community center. That means you don't have a police force. You have no money left over. You just built affordable housing, and in 17 years, you would have cleared up the backlog. And for those of you that understand plain logic, that also means 17 years later, you've just created another 17-year list. That is the fundamental problem. And I follow up on Councillor DeMerla's comments. It's why it's very easy to be critical of the private operators, but if the government had to step in and operate all 100% of them, you can't print enough money to get you there. And I think that's what the provincial and federal governments are cognizant of, which is why I think the situation's festered as much as it has. So this is a very challenging issue when you also consider in a report done for the OECD, Organization of Economic Cooperation and Development, that I've referred to before in either 2017 or 2018, that said, if you live in the more advanced world and you were born in that year, 1/2 of you will get to 100 years old. And I've said the tragedy of that will be so many of them, unfortunately, will outlive their bodies, their minds, their money, their families, and the state will have to look after them. It is a crushing challenge, to bring me to my conclusion, which is where we only collect 6, 7, 8, 10% of the tax revenues generated in this country. If our provincial and federal partners don't step up, we are dead in the water. I will leave it at that. Madam Clerk, the vote over to you.
Thank you. And I'll read out the motion, and again would require confirmation from Councillor Santo and Mayor Thompson to their agreement to the friendly amendments. That the regional
Yep, I'm great with this. Oh.
Thank you.
Thank you.
So am I.
Thank you. That the regional chair send a letter on behalf of regional council to the Premier of Ontario and the Minister of Long-Term Care to convey regional council's support for a provincial inquiry into long-term care in Ontario, and further that the region of Peel continue to advocate for immediate action and resources to enhance person-centered care and address known gaps in long-term care homes. Might I also suggest that this be copied to local MPPs and MPs?
Madam Clerk, to conduct the vote, please proceed.
Thank you. All in favor, Mayor Brown.
Yes.
Mayor Brown in favor, Councillor Carlson.
Yes.
Councillor Carlson in favor, Mayor Crombie.
Yes.
Mayor Crombie in favor, Councillor DeMerla.
Yes.
Councillor DeMerla in favor, Councillor Dasco.
Yes.
Councillor Dasco in favor, Councillor Dillon.
In favor.
Councillor Dillon in favor, Councillor Downey.
In favor.
Councillor Downey in favor, Councillor Fonseca.
Yes, in favor.
Councillor Fonseca in favor, Councillor Fortini.
Yes, in favor.
Councillor Fortini in favor, Councillor Groves.
Yes, in favor.
Councillor Groves in favor, Councillor Innes.
Yes, in favor.
Councillor Innes in favor, Councillor Kovac.
Yes, in favor.
Councillor Kovac in favor, Councillor Mahoney.
Yes.
Councillor Mahoney in favor, Councillor McFadden.
In favor.
Councillor McFadden in favor, Councillor Medeiros.
Yes.
Councillor Medeiros in favor, Councillor Paleshi.
Yes.
Councillor Paleshi in favor, Councillor Raz.
Yes.
Councillor Raz in favor, Councillor Sado.
Yes.
Councillor Sado in favor, Councillor Santos.
Yes.
Councillor Santos in favor, Councillor Sinclair.
In favor?
Councillor Sinclair in favor, Councillor Starr.
Yes.
Councillor Starr in favor. Mayor Thompson.
In favor?
Mayor Thompson in favor, Councillor Vicente.
In favor.
Councillor Vicente in favor. It's unanimous. Thank you.
And well done to all. Thank you. Moving on, our next presentation, 8.2, responding to the COVID-19 outbreak in Peel Region, core indicators to guide reopening. An oral presentation from Dr. Lawrence Lowe, our interim medical officer of health. Lawrence.
Thank you very much, Chair, and greetings, Regional Council. Before I begin my presentation, I'm happy to speak to the two questions that were referred to me during CAO Polsinelli's remarks presentation. In respect of testing, treating, isolating, I will be speaking to this in my presentation. And I wanted to sort of add my perspective around the long-term care and the question and analysis around public and private. From our perspective, and just recalling that public health is external to the long-term care sector, and obviously that we have been trying our very best to support or collaborate with our colleagues in that sector. I personally, as well as many within public health, was quite disturbed by what was revealed in the report yesterday. It is clear that a broader inquiry is needed and that a significant analysis of data will be undertaken. So at this time, it's probably premature for me to comment as to the various factors, public-private obviously being one of them, that may be looked at through that analysis. But I will say that Peel Public Health, having supported many of the outbreaks in this setting, we do have data and insights that we have recorded, obviously, that will presumably form the basis or be used in the course of any inquiry. And I think it also will be helpful, at least in terms of a broader analysis in the future. For now, obviously, as you'll see in my presentation, our focus is very much shifting to workplaces, but that data still remains, and it's certainly something we'll share. I think also the question as to why certain homes have been worse than others or have had more challenging outcomes than others really speaks to just the confluence of factors that have dictated the outbreaks in these homes. And to that extent, there are many human as well as non-human factors that have been associated with why different homes have seen different results. And I think it will then come to the review to take both a look at the summary data overall, but there will also need to be a lot of in-depth looks at houses that had certain results that seemed more positive and certain results that maybe were more tragic than had been anticipated. So all that to say, I think an overall analysis will be coming through the provincial inquest, and public health will certainly support that, with our data and our insights as we have. With that, I will move on to my presentation, knowing that time is short. And so I wanted to start out by stating that it is very clear at this point that Peel Region has averted the worst of COVID-19. And you will all recall in March when I spoke of the need for us to act quickly and decisively during the golden period. I can say pretty much with confidence now, having seen things transpire over the past few months, that we very much did succeed in making the most of the golden period in disease transmission and have largely avoided the results seen in other places around the world, save and except for that which we are discussing in our long-term care sector. This has led to our current situation where we are essentially still watching a slow pandemic start to simmer, a mostly flattened curve that is progressing alongside reopening discussions and the allure of summer. And this presentation is to inform Council about changing data and testing landscape that we are contending with as we progress into the next phase. Next slide, please. Many of you have gotten used to hearing from me and speaking about cases and deaths in our community. This is the most basic measure of any outbreak. It allows us to get an understanding of the size and the shape of the problem. And certainly you've also seen us provide additional slices of the same tied to where these cases and deaths might be occurring, where outbreaks may be associated, exposures, elements around occupations, and all the insights that you've seen in our weekly epidemiologic analyses that have also helped to inform our recommendations and decisions. However, as we move towards returning to a new normal, we know that this metric alone must now be supplemented by other data in order to paint the full picture. And it is, to a large extent, the picture that has supported the message that I've delivered so far, that the situation in Peel is different from many other places in Ontario. However, I want to be very clear that this is where the difference ends. And I want to clarify some recent media reports by stating that Peel Public Health and all other health units in the province continue to work very closely with our Chief Medical Officer, Dr. David Williams, and the Ministry of Health in advancing a coordinated pandemic response that is based on the provincial framework for reopening. We'll go to the next slide, please. I don't quite see this perfect. There we go. So in using the province's framework, Peel Public Health has started tracking enhanced metrics under various themes to help paint that picture. These metrics are intended to bring more data and specificity to the state of COVID-19 in our region. Peel Public Health is using these metrics conceptually in support of the province's own framework for reopening and identifying the overall trends of COVID-19 in our community, together with trends in capacity in public health and healthcare system response. To further clarify recent reports, these metrics were developed with certain health unit partners, and while health units across the province continue to explore the value of these metrics, it has not yet been formally endorsed by the Council of Medical Officers of Health, which represents all 34 health units. However, all health units are aware of and continue to discuss and explore the value of these metrics as it pertains to their communities. In addition, these metrics were developed to support ongoing collaborative dialogue with our provincial partners to better understand and inform decisions around the pandemic in our communities and across the province. With those clarifications, I can actually share that our initial minimum set of metrics that we are exploring and using here in Peel include, under viral spread and containment, we are now tracking a 7-day moving average of daily new COVID-19 cases in the community. This helps to measure transmission in the community, and you will have heard me speak to this in public in recent times because it is a trend that we are watching carefully. We are also tracking a 7-day moving average of daily new hospitalizations to measure the severity of the disease in our community. We are also tracking a percentage of new COVID-19 cases for which there is no link to travel or a known case or outbreak. This measures how effectively chains of transmission are being identified in our community. And we will also begin to track a new and cumulative number of institution and congregate care settings that are in outbreak, which is really meant to keep our eye on the picture that is occurring in vulnerable settings, such as our seniors care settings. Under healthcare system capacity, we are tracking the following, which are self-explanatory: percentage of acute care beds occupied, intensive care beds occupied, intensive care beds with ventilator support that are occupied, and personal protective equipment stock, days in reserve. For tracing, we continue to track the percent of newly reported COVID-19 cases that are reached within 24 hours and within 48 hours. This speaks to Councillor Sinclair's question around where we are with tracing, because the tracing and the isolation aspect of the test, trace, and isolate is very much is still in the wheelhouse of public health to ensure that we are identifying and managing cases quickly and identifying their contacts so that they are isolated and not potentially putting the community down. And then finally, in respect of testing, we are now tracking the percentage of positive COVID-19 tests for which we have a turnaround time of 24 hours and of 48 hours. This allows us to measure our ability to identify cases in a timely manner. And testing, as many of you have heard in the past week, is very much a provincial responsibility in terms of the logistics and the operations behind it and the criteria that are set. We continue to await the provincial testing strategy to understand what that will mean for us here in the region of Peel, and continue to also provide input from a public health perspective and an understanding of our community's perspective to ensure that there is clear guidance around how and where this testing strategy gets rolled out. The other metric we are measuring under testing is COVID-19% testing positivity, which measures both testing capacity as well as disease activity, and really speaks to something that I have been describing around testing, which is it is important to test more, but it is also important for us to test more of the right people. As we begin to explore and use these metrics here in the region of Peel, I want to add some careful points. We will report these metrics publicly in our weekly epidemiologic report as an initial step. We will continue to work with the province to interpret the signals they send in formulating recommendations for us in Peel and informing decisions that are taken provincially. I want to be clear that these are not accountability indicators, but rather situational touchstones that are intended to guide decision making and get an overview of where we are. And finally, these metrics will always be measured for their performance. If need be, we will add, remove, or modify the metrics we are using to ensure that we are making the best decisions on the best data. Finally, while these indicators are one piece of informing my recommendations, I want to make clear that they are not the sole criterion in doing so. These metrics, as we explore them, continue to be examined together with an understanding of context and of evidence as it outlines in our community. And these indicators should not typically be used individually unless there is a clear reason to use them in that manner. Finally, decisions continue with our provincial counterparts and other health units as to how these metrics might be interpreted more widely. But for the time being, I will share a slice of what we are seeing here in Peel. Next slide. As I mentioned, under viral spread and containment, we are starting to track the 7-day moving average of new community COVID-19 cases in Peel. The purpose of a 7-day moving average is to eliminate some of the daily fluctuations and spikes and to provide a clearer view of the overall trends as they pertain to those 7 days with the data that you are using. You will all recall that on the announcement of the province on May 19th to move towards phase 1, I made the recommendation that we were not quite ready in Peel to move forward. A lot of that was based on the metric you see before you today, which shows that between May 13th and 20th, our 7-day moving average of new cases in the region of Peel that are in the community has gone on an upward trend. It is for this reason, as I mentioned, we typically do not want to make recommendations based on a single metric, but in this situation, that specific trend that you are seeing at the very end there was enough for me to essentially say, we're not seeing a decline in viral activity in our community. We'll go to the next slide, please. Another example of a metric that we are measuring is public health system capacity and contact tracing, as I mentioned. And at this time, with the case counts that we are receiving and the operations that we have put into place, we are able to reach 96% of COVID-19 cases within the identified provincial benchmark of reaching them within 24 hours. That will obviously be impacted both by operational decisions, if we do need to move a staff back to their base positions and continue with work. And that can also be impacted. You can also see a degradation in service level if we do see a surge in cases as well. So this is yet another metric that I'm keeping a careful eye on. And it speaks to the idea of needing to take all the metrics together to understand where things may be at. Next slide, please. Now that I've provided a taste, I can also share the overall picture as it stands. And for the time being, as you can see, our current read is quite simple and explains my message from recent weeks. We aren't seeing things decrease on viral spread and containment. And I want to clarify as well that the red X's and the greens that you see above there are based on various thresholds that we are continuing to work out with our partner. The one that I am concerned about and the one that we continue to discuss as we explore these metrics is the hospital capacity one. It appears green right now, but we know from our hospital partners that this is tenuous, that they still have many patients with COVID and remain at a very high enough utilization on the borderline of the provincially identified metrics that they may not be able to start up elective surgeries and treatments and other pieces, just given where we are right now. So taking that all together, and this slide is simply a snapshot of everything, we are hopeful that we can start to use these metrics more, understand our local situation, and continue to work collaboratively with our provincial partners to move forward together. Next slide. So a few last pieces. In addition to this new indicator framework, there are other pieces of the puzzle that have come to the top recently this week. The first is around enhanced testing. As I mentioned, we continue to await the province's testing framework while we work with our hospital partners to address the increased demand that has followed the recent announcement. For our region, it is important for us to take the expanded criteria carefully, since our capacity should ideally go first and foremost to those who are most at risk. It's also important to underline, as I've said, that testing is ultimately a provincial matter, So public health works very closely with Ontario Health and the province to look at how we can facilitate this in certain settings. And we also will act quickly on the results as they are identified. Secondly, around sources of transmission in PO, we continue to address spread in workplaces and households while also stopping spread in long-term care settings. And as we see spread continue in our community, however, specifically in workplaces and households, it's a good opportunity for me here to reiterate the importance of avoiding crowds, physical distancing in public, and hygiene, and non-medical masks where one cannot distance, such as indoor retail or transit. Everyone must do their part, and every proprietor in our community must do their part as well. That will help to at least address some of the increases in workplaces and household clusters that we have started to identify. Under this, I wish to also address the geographic mapping of cases, which has gained recent traction and interest. Peel Public Health has been looking into this for quite some time, and this week we will start to release a static map in our weekly epidemiologic updates as we move towards an interactive map that has been released by other jurisdictions. I want to caution that the use of geographic data has a number of caveats. It should not give license to the public that we can let our guard down in certain areas of our community and others, and not in others. We know that people with COVID-19, when they're diagnosed, should absolutely be staying home, but there are some that may disregard this order, and there are also some that may not necessarily have been diagnosed yet. They can circulate anywhere in our community, also all the people that circulate in our community through the Greater Toronto Area. Geographic data also needs to be interpreted carefully. Oftentimes, what you are seeing is where people live rather than where they got the disease. And like the indicators I presented earlier today, geographic data is but one tool for understanding all risk in our community. And finally, any release of geographic data needs to be done carefully in order to avoid stigmatizing existing neighborhoods or communities. We are looking into, for example, the possibility that by virtue of various determinants, often beyond people's control, some people in our community are simply at a greater risk of exposure than others, and they should not be faulted for that. In other settings, we know that COVID-19 has also, in other jurisdictions, we know that COVID-19 has brought into sharp focus disparities on many different determinants, and we continue to explore those in the region of Peel through our analysis as well. Thus, in responding to public concerns, I continue to move forward towards reporting geographic data carefully in a manner that clarifies context. I know that's a lot of information. I know that it was very detailed, but I want to thank Council for their continued support and attention, and I'm happy to take questions at this point in time.
Thank you, and I have a list. Councillor Sinclair.
Yes, thank you. Through you, Chair Anika, to Dr. Loh. Excellent presentation, answered all my questions for now. Thank you very much. I'm happy to move it at the time comes, Mr. Chairman.
Thank you. Councillor Demirla.
Sorry, just trying to figure out how to unmute myself. I just want to thank Dr. Loh also for an excellent presentation. I just want to say it's fantastic. It's the sort of stuff I've been looking for, which is some metrics. So Dr. Loh, thank you very much. I also want to thank you for your leadership based on all the media reports that I've been reading. Clearly, you've shown commendable leadership, and I really thank you for it. And I'm happy to second the report. I just have some questions based on your presentation. And the first one is, I know you showed us the moving average until May 20th, which showed an uptick. I wanted to know if we had any data. I know we have the data, but whether you can speak to the period from May 20th to 28th and whether there is positive or negative news on how the caseload is trending, whether it's trending down, up, or flat. That would be my first question. My second question is, I was reading in the media some reports as to the data around, where the transmission is occurring has been misclassified across the province. And I think that there was some report about close to 5,000 cases being suddenly reclassified between yesterday and today. So I just wanted to get your sense of the integrity of this data and whether with this update we have a good understanding or a better understanding of where the infections are taking place within the community. I keep hearing workspace, but perhaps you could speak a little more to that. My third question is, you've given some very clear parameters that would guide us in reopening, and you've also given the rider that those parameters could change or additional parameters could come in play. Acknowledging all of that, should we see a 2-week decline in cases, does that take us into phase 2 of reopening? I'm just trying to understand what that would mean if we were to hit that. I'm also trying to understand the jurisdiction. So I understand that as a municipality, the city of Mississauga has control over municipal facilities. Do we open parks? Do we open community centers, et cetera, based on your parameters? But what about the bigger issue of the businesses reopening? So the province has now said that, for instance, any business with, I guess, a front door or retail on the street is able to, not any, but some businesses are able to open and move ahead. So I just wanted to know how your parameters, is there any connection between the parameters you have presented and the non-municipally controlled opening of workplaces and other things? Thank you.
So through you, Mr. Chair, thank you, Councillor Demerla, for the question. I'll go backwards with the questions that I've jotted down here in respective jurisdictions over non-municipal facilities and where these metrics fit in. In general, the use of these metrics will inform, as I mentioned, one part of my overall recommendations, obviously trying to understand community context and other pieces around reopening. But from my position, it would really be a matter of providing strong recommendations in the event that there seems to be a different picture versus what we may be hearing at the provincial level, and or resorting to actions either under the Health Protection and Promotion Act from my part, or measures that may sit with all of you as councils, either here at the regional level or at your municipal level. In the event that my recommendation on the basis of these metrics may point to the need to maintain or put in place certain restrictions. So the metrics really help to inform the picture, but the decision would be taken under the existing mandates and powers that we all hold. In terms of the question around what would happen if we saw a 2-day decline and would that mean phase 2? Again, that goes to my point around why we will try to be very careful about using any single individual metric at any given time. Because, for example, if we did have the situation where we saw a 2-week decline in cases, but our 7-day moving average was still at a certain level. So let's say it was, let's say for the sake of argument, thankfully it's not here yet, but let's say the 7-day moving average was in the 200s and declined for 2 weeks down to 100. But the rest of the indicators showed that our hospitals were over capacity, our tracing capacity was overwhelmed. I mean, I don't think then we would be like, yeah, let's move to phase 2, right? I think we would say, okay, we need to keep watching that and looking at the overall picture. So it is a matter of trying to use all these metrics together to really paint the full picture of what we're seeing and then inform, at least for me, to inform my recommendations of how we can move forward. In terms of the questions around data and misclassification, I also saw the same reports that you had there, that you had seen there, and I'm trying to get further clarification from Public Health Ontario as to what the issue is. I think many people know that the existing data systems that have been used in public health have been challenged, at least by how old the systems are, and really just sort of and trying to work through those with a significant volume of cases. So I'm still trying to get further information on that. And in respect of the 7-day moving average over the past week, my understanding is that it has stabilized somewhat, but I do need to check back with my team to be exactly certain. And as I mentioned, we will publish the official aspect of the metric in our weekly epidemiologic summary, which is due to come out tomorrow, and that will be as you know, with my recommendation to Mississauga Council yesterday, I felt a bit more confident that we have identified both a trend that is a bit more reassuring. Certainly maybe a gradual increase, but certainly not the spike that you saw on slide 4. And also that we have a firmer idea of where these cases are occurring in our community. So thank you very much, Councillor DeMerle.
So if I can just ask a couple follow-up questions. I'm not sure if I heard around, do we know where the transmission is occurring in Peel, and particularly in Mississauga? I know that it's moved to the community, but it's not clear what is triggering it. If you could please speak to that. And my second question is, I really like the graph that you have in the presentation. I was looking for a similar trend graph that shows in a graphic format, the trend lines for cases on the Peel dashboard. Maybe I missed it or it's not there. Perhaps you can clarify if it's there, then I will go back and look for it. And if it's not there, it's really helpful in terms of informing the public and being transparent as to where we are. As I made the case yesterday, I think these benchmarks are great because it helps us with our communication with the public. And I think it really goes a long way of getting voluntary compliance with the public if we are able to say these are the benchmarks we need to hit, sort of, broadly, not the only ones. And this is why we need to continue to be very careful and not move into opening. I think we will get a lot more voluntary compliance if we can make the case with these benchmarks. I really appreciate it.
Yes, so through you, Mr. Chair, thank you, Councillor DeMerle, for the follow-up questions. The weekly epidemiologic summary has a curve that really shows the cumulative and probable cases that you're referring to from the dashboard for the whole region of Peel. It also identifies specific dates of interest as to why the curve actually appears that way. Firstly, I think the 3 points that we flagged on that curve in the weekly epi summary speak to the first case in Peel, the start of the enhanced surveillance that occurred in long-term care settings, and then also the reopening on phase 1. So it actually provides a bit of a guide and legend as to why the curve may look the way it does. And as I mentioned, that is bread and butter public health. The most fundamental thing about an outbreak is you count the cases, you count the severe cases, and you count the deaths. That's where we start from. In respect of the other question around identifying a transmission and where things are at, with every positive case that we receive in the region of Peel, we have public health nurses and case managers that basically interview the individual and try to identify where they may have received the exposure, as well as any close contacts that they may have had during their period of communicability. And then they also advise the case on steps that they can take to reduce transmission risk to others, as well as to take care of themselves. And so that work has continued. In the midst of the increase over the past week, there was a large focus, and what we needed to do was really figure out where a whole number of these cases were obtaining it. Now we've been able to trace them all back to specific clusters, which is why we have a little bit more confidence as to where this is all occurring. So that's essentially how that has changed over the past couple of weeks.
So are you able to share those clusters? That's what I'm trying to understand. Where is this infection taking place? I understand that you've been able to trace it back. And my last question is this information something that I can share with my constituents in terms of the benchmarks and stuff like that? I just wanted to know if it's okay to share that. I'd like to be able to share that.
Yes, through you, Mr. Chair. Thank you, Councillor DeMerle. So yes, this can absolutely be shared, and of course with the caveats, as I've mentioned, that we're really using this at least as an exploratory guide for us in the region of Peel while we continue our discussions with our other health unit partners and with our provincial partners. But there is certainly a lot of positive interest in using these indicators, and to a large extent, I think for us in Peel, we've seen some good outcomes from using these indicators, and I think we'll continue to monitor how the metrics perform, but I think it'll be helpful in supporting our recommendations going forward. On the case of details around clusters, you'll recall, Councillor DeMerle, that I had sent an update to Council a couple weeks ago just around the balance that we strike between protecting the personal health information of people and businesses that have been impacted by this versus the need for public disclosure and transparency. And so in general, through the course of our investigations, if we do determine that a public exposure has occurred, you will certainly see us issue a public release stating, this is where the exposure occurred, it's connected to this outbreak or to this cluster. In other settings, it is really similar to a doctor providing a diagnosis. It may be appropriate for a patient to share that they have a diagnosis, and that's entirely their prerogative. But it becomes much more challenging for a physician. It's not really a physician's place to share exactly who or where things may be happening. In a broad sense, though, and I know maybe this is something that can sort of help to strike a balance in what you're asking, we are doing analyses. Obviously, right now, our immediate focus is on the response to these outbreaks, but we are trying to do analyses to see if there are certain sectors or if there are certain groups that are at higher risk, and really to then take a proactive reach out together with the Ministry of Labor, for example, of its workplaces or et cetera, to essentially try to get ahead of this by taking proactive measures and checking in with some of these sectors. And that analysis is ongoing, but is not quite ready at this point in time for me to speak to.
Thank you very much.
Thank you. My list is Crombie, Groves, Raz, Dasco, Downey, Brown, Fortini. Mayor Crombie.
Thank you for this opportunity, Dr. Lowe. I just want to thank you for your leadership and for standing up for Peel. As you've rightly pointed out, the situation here is different than other communities, and I guess I wonder if Dr. Williams, why he didn't allow a regional approach to begin with. Certainly, I know that the Premier was taking medical advice from the medical professionals like yourself and others. So was it Dr. Williams that was an obstacle to us to taking our own approach initially?
Through you, Mr. Chair, and thank you, Madam Mayor, for the question. Dr. Williams has actually been, certainly the focus of much scrutiny throughout this response. But I can tell you, having worked with him previously at the Ministry of Health and Long-Term Care, I know that he has excellent technical skills in terms of understanding the data and the contexts that are there. And I know that we, at least as medical officers of health, are constantly in contact and collaboration with the province. So I imagine he would have taken a close look at the situation throughout the province and probably made some representations as pertains to his professional expertise in the same way that I do for the region of Peel.
I know that was a bit of a political hot potato. I apologize. On the interactive map, which I thank you to bring forward, it'll be, I guess, static until we can get it interactive. And how long will it be until it is interactive, approximately?
So through you, Mr. Chair, thank you, Madam Mayor. Recognize certainly there's interest in the interactive map, and we are basically we're basically responding immediately to public interest by publishing a static map. And once we can get the technical details behind the map and reach out to the other health units that have gone before us to understand how they've done it, and also most importantly for me, because this is for me in my role, figured out a way for us to message this carefully, we'll be able to launch it. So, but I am hoping it's sooner rather than later. So we're talking dates.
Thank you. And I know that Ottawa and Toronto have done so already. My worry, Dr. Lowe, is that it will show us where the most densely populated areas of the city are, and perhaps those vulnerable communities and neighborhoods, largely lower income and newcomer populations reside. Am I wrong about that? And is there a risk it's going to stigmatize certain communities or neighborhoods, rather?
And so through you, Mr. Chair, and thank you, Madam Mayor. I spent a brief moment yesterday, and just to clarify, I do sometimes not work. I did spend a moment on Zoom with some friends yesterday evening. I was quite perturbed where they were actually looking through which neighborhoods in Toronto had been identified as hardest hit, and just saying, "Well, I guess I'm not going to these places." And I think it really speaks, my friends are, I know they were probably doing it in jest to some extent, but I know that there are lots of people who are going to, if we are not careful in how we message and nuance this carefully, it will certainly result in stigmatizing. And often, many of these neighborhoods are already neighborhoods that face significant challenges by virtue of other aspects of their community makeup. that I think we must absolutely be treading very carefully in how we message it.
I completely agree with you. I mean, we want to be transparent. We want to provide full data. However, there is a little sensitivity around this, so I hope you do nuance it in that way. My next question is about our capacity. So certainly, the Premier has said anyone who is thinks they're COVID positive, or anyone asymptomatic who is a frontline worker, who is at greater risk and exposure to COVID, or someone who lives with someone who has been exposed, are the priorities. So do we have any more information from the province on their strategy on how will they help us increase our capacity to provide testing, and then on the other hand to do the analysis of the testing, and then to do the contact tracing, which you yourself have said we're only about 10% capacity there. So what do we do? What are we looking for from the province, and how do we get the testing to the highest priority people who are at greatest risk? How do we target those folks first? And, will mobile sites be a part of the equation? And do you have any information about the provincial strategy and when it may be released, and any insight to what it may offer? And will funding come with it? Because I assume that to increase our capacity will require additional funding.
Yes, so through you, Mr. Chair, and thank you, Madam Mayor. I am continually in discussions with our provincial counterparts, and have been very much so since the weekend announcement. In respect of testing, I can state that there is a great interest in exploring all sorts of different modalities around testing. For example, mobile is certainly something that has come up. Questions around how we start making use of primary care physicians. As you know, here in the region of Peel, we have over 2,000 different primary care physicians that are practicing. So there are lots of questions that we as Peel Public Health have been able to provide input into, and certainly insights into, both around the criteria around who should be tested, as well as the means by which this should get rolled out. I understand that the provincial testing strategy is coming soon. I have been grateful for the opportunity to provide input into it, on behalf of Peel Public Health through our provincial counterparts, and I'm hopeful that it will also provide a little bit more details around how we'll be able to scale up and serve our community to make sure that that is supporting our ongoing testing and tracing efforts.
Canada Day is coming soon too, and I very strongly feel that the testing strategy should have come ahead of the reopening strategy. So that's just my opinion. But it's not blaming you. I'm blaming the fault where it belongs, which is where was the strategy before. Two more questions, and I know there are lots of people who have questions, but what percentage of the population of Peel do we think have been infected? I know that, I think it was Michelle Emmanuel suggested to me it could be as high as about 14%. Do you have any idea about that?
Thank you very much for the question, Madam Mayor, and through you, Mr. Chair. This is actually another piece that I would speak to, which is we do know that the federal government has approved serologic testing, and I imagine that is going to be some parts of a provincial testing strategy. But at this time, without serologic testing available and without the opportunity to do a broad sero survey, it is a little difficult to find data that allows us to extrapolate how many people may have been infected with this in the region of Peel.
Okay, and my final question is, you mentioned the warm weather factor, and then there's the isolation factor. People are social beings. I think there's a real fatigue, COVID fatigue, and people are willing to take greater risks today than they were 10 weeks ago. And maybe as we see the weather improving, maybe not today, but hotter weather, will they be less compliant? Do you see that as well? Was that why we saw the spike? Was that Mother's Day? Was that increased testing? What was that you could relay it back to? And then do you see that fatigue in the communities?
Thank you, Madam Mayor, through you, Mr. Chair. I certainly do see the fatigue. I recognize as well it has been here for a long time. But as we've always said, and I would reiterate certainly for council and also for the community, we've known that this was always going to be a much longer term proposition than just getting through the winter and the spring. And to a large extent, until a vaccine or cure is found, physical distancing, hand hygiene, avoiding crowds, these are all going to be the measures that we will need to figure out. And I will say this, the idea that it's going to be only 5 people, from different households as a group limit in the long run, there is going to eventually need to be, and I imagine the province is looking at this closely, some sort of striking a balance between allowing slightly larger groups, but also not necessarily having a rock concert, sort of level sort of crowding, and then also still being able to measure on those metrics whether decisions like that are having an impact. And then I think, Madam Mayor, that actually speaks to the first question that you asked, which is, do we know what happened 2 weeks ago? And based on the metrics, like I said, we didn't necessarily have all of these metrics back then, so it's tough to say for absolute certainty. But there have been a lot of different components, a lot of different things that have been hypothesized. Certainly, increased testing was a part of it that would have driven more positive case finding. But we do know that it was Mother's Day. We do know that retail had opened on Monday of that week, and whether it's specific retail or whether other members of the communities took that as a sign to let their guard down, all of these are part of the ongoing analysis that we are doing at Peel Public Health, in addition to the tracing and isolation work that we're doing. And I think over time, more and more questions will become, the answers to questions will become more apparent, particularly as we start to use these metrics on the go forward.
Thank you. I'll conclude just by saying that the places of religious worship are where I feel people really have a need to get back to. Obviously the backyard parties, the dinner parties, but I've heard from many, many people, they want to go back to their churches and synagogues and mosques and gurdwaras and pray again and gather to pray and worship their God.
Yes, thank you, Madam Mayor, and through you, Mr. Chair. We recognize this as well, and we recognize that there are lots of health benefits to community and to cohesiveness. I think humans by nature are very gregarious, and I think the goal and the hope, and I said this in my press availability with you, Madam Mayor, yesterday, and I believe with you as well, Mayor Brown. The trouble is that the further up the curve we go, the longer it takes to come down. And so I think to the extent that we can try to hold steadfast and take the measures we need to get those numbers down, then hopefully we'll see a return to group gatherings of the nature that are being described sooner rather than later.
Thank you, Dr. Lowe, and I should have added Menders.
Thank you.
Thank you.
Councillor Groves.
Thank you, Mr. Chair, and thank you, Dr. Lowe, for your presentation. Always helpful as usual. Just my questions actually really revolves around testing. I hear what you say, and I see that in your presentation, next steps is enhanced approach to testing, and I understand that this is all a provincial, testing is all up to the province, but I think we need to be a leader in testing as well. So I hope that we will continue our advocacy with the province. The concern that I have is, and you heard in the news recently about people that are asymptomatic. We have, I'm sure, many of those people walking around. They have no symptoms, so therefore they can't be tested because they have no symptoms. So I have a real concern around that. The other thing that I think is a really good thing with regards to is serological testing, because I do think that you need to understand. I think that, I mean, I'm not a doctor, but Dr. Lowe, you can certainly comment further on this, but I think that it's important to have that to understand what sort of, we have to really, the immune system is really important to build immunity against certain viruses, but I guess this is where serological testing comes in to understand what type of antibodies you're carrying and how to build immunity against certain viruses. So can you comment a little bit further on the serological testing? Because I do think that that's an important part of testing that we need to have. And also testing regarding asymptomatic folks, how is that working? Or because I know that the numbers that I saw with regards to the testing, it was actually quite shocking that the province of Ontario is so far behind in the number of testing that they had put out earlier. I think they said 20,000 people, but we were only at 5,800, something like that. So maybe you can expand a little bit more on that, Dr. Lowe, and what our role is in Peel Region in advocating for more testing and also testing of asymptomatic folks.
So through you, Mr. Chair, thank you, Councillor Groves, for the question. Maybe the best way for me to structure my answer is that when it comes to testing, there are two types of tests, right? There are diagnostic tests and immunological tests. Diagnostic tests test to see whether you have the virus. Immunologic tests test to see the immune response. So it determines whether you've had the infection previously or not, and whether you may have some sort of immunity. And so the swabs that we are using and the tests that are being done right now speak to the first category, which is diagnostic tests, and the serologic tests speak to the second category, the immunologic aspects of things. When it comes to testing in general, in terms of the tests that are being done right now across the province, 20,000 is the official testing capacity for the province. And to some extent, you want to be able to test at whatever benchmark. I believe the provincial benchmark that was set was 16,000. And especially with asymptomatic transmission or asymptomatic cases, as you've identified, we certainly want to be trying to hit some sort of provincial benchmark as identified. But to a large extent, we actually don't necessarily want to be testing anybody and everybody to reach that. So I think I explained it this way. When you're fighting a fire, you're trying to go where the fire is. And so if you're spraying a bunch of water on a completely separate building in the neighborhood that's not actually on fire, you could do 20,000 tests, but not actually pick up anybody. It may actually not necessarily have its intended effect if you're not risk stratifying who you're actually testing. So I do recognize, at least provincially, there's been a lot of challenges with getting the number of tests done. I think it reflects a number of things. First of all, it reflects to some extent the demand for testing. I think to some extent it also reflects the extent of spread in our community. So perhaps there hasn't been, as much spread. Hopefully, this is perhaps my wishful thinking, but perhaps it just reflects that we're not seeing as many people who are symptomatic or sick that need to present for testing. It also reflects to some extent the criteria that were only loosened by the province on May 14th, and for which I actually supported the loosening of, because we do need to get behind all the other pieces that have been identified here in terms of really starting to stamp out the last embers of transmission. So in that sense, Councillor Groves, you're absolutely correct that we need to be testing asymptomatic individuals, but the kind of asymptomatic individual that we are looking for, at least with the recent provincial criteria, is specifically people who are asymptomatic contacts of COVID-19 cases that we're aware of, and also asymptomatic people who have a higher risk of transmission. So if a resident, for example, has listened to my advice and my recommendation and has really spent most of their time at home over the last couple months, and except going out to exercise on their own and getting groceries, their risk is a lot lower than an essential worker or a bus driver or a bylaw enforcement officer who's been on the front line interacting with the public day to day. And so that's kind of where we need to be able, especially given the capacity and especially given the goals to actually go where the fire is, to start testing people who have possibly had more exposure. And I mentioned those frontline workers, but it could also be, as I mentioned to Councillor Demerla's question, as we start to understand different sectors, different workplaces, maybe we need to be targeting certain sectors or workplaces more, because we also identify a risk there as well. So asymptomatic testing is important, and especially given how COVID-19 does have some risk of asymptomatic transmission, it's absolutely crucial for us to figure out how we do it. But it's also critical for us to make sure we're doing it in a manner that actually gets to the chains of transmission and actually identifies those things. And then in the long term, in terms of serologic testing, as you've identified on the other side around the immune system, we have the good fortune in Canada that many other countries have gone before us and have started doing serologic testing. So in terms of trying to understand, do people get a lasting immunity out of this or a partial immunity, and how long that immunity is, those are all questions that are being answered by studies around the world. And hopefully, as we start to pursue serologic testing here in Canada, we'll be able to understand some of those as it pertains to our population.
That's great. Thank you, Dr. Lowe, because I think it is important to understand this virus, because while we're focused on a vaccine, I think we need to focus on the other side of it too, is the immunity against the virus, because I think that's a really, really key piece in actually, I guess, flattening the curve or just getting rid of the virus entirely. Not sure that that will happen, but I don't know that. I guess the messaging, Dr. Lowe, around testing from the province is a little bit confusing for the public. So, you know, the premier says, "Oh yeah, get everybody tested, just test everybody," and then, you know, we're being told on the other hand, well, we can only do so many tests or test certain people. So I think they need to be very clear on their messaging so that the public is aware and the public understands. Because right now, I think a lot of us are just confused with that messaging, because it's a little bit of a mixed messaging in there. So, you know, whatever you can do to speak to your counterparts at the provincial level, that would be great. And I just have a final question with regards to some of the business openings. And I see that next week there's another round of business openings, and some of those are the health service providers. And I've heard from a lot of our healthcare providers and our physicians and dentists and chiropractors and physiotherapists and that. I mean, they have real concern. So is it the region appeal? So if the province opens that up, what role does the region appeal play in these businesses or these health services opening up?
So thank you very much, Councillor Groves. And first your comment around provincial counterparts. I am in constant contact with our counterparts at the Ministry of Health, our Chief Medical Officer of Health, David Williams, and also Ontario Health Partners. We're constantly discussing this and really making sure that the strategy will come forward. At this point, I very much have gone forward, as you've heard in my submission today, with the Ontario Health criteria that were released on the weekend. And so I would reiterate it again, not just for council, but for the wider community. We are really specifically trying to target people who are symptomatic of COVID-19, as well as asymptomatic contacts of those individuals and asymptomatic individuals who may have an increased risk by virtue of their work or their line of duty. And so that essentially is a very wide number of people, but it is somewhat different than the various messages that have been put through in the media at this time. In respect of health providers, you know, the region of appeal actually has we have engagement through these health providers just in terms of from a collegial perspective, and also in terms of helping them work through various guidelines and protocols in clinical practice as it supports public health work. But specific to infection prevention control and all these other pieces in this setting, these have traditionally been the purview of their regulated colleges. And my understanding is that they can proceed to open up if their colleges have actually identified a means for them to do so safely. From my perspective, I think what we would want to see in public health, and ideally this will all come from the various provincial regulatory colleges, but I imagine it will be things like enhanced infection prevention control, crowd control in clinical settings, making sure that they are keeping track of who's on the premises, they need with contact tracing if someone does test positive, making sure that they're wearing personal protective equipment. I imagine all of that's being discussed and will probably come down in guidance from the regulated health professionals associations in the province.
Great, thank you. And just finally, I just need a clarification. Martial arts. You know, the province listed a number of sports and organizations that can open, and that martial arts wasn't listed as one, but I have a number of martial arts businesses in my community, and they're all concerned that they're not on the list, and I don't know if they're going to be in phase two of reopening. But I know that the martial arts community, they also, the service that they provide is just not for physical well-being, but it's also mental and emotional well-being. And I know, because I visited one, and they've explained how they would be able to provide physical distancing and non-contact. So they have opportunities for folks to come in and members to come in and still practice martial arts in a non-contact way. How do we get the message to, where do we go from here? How do we get the message to the province to address these types of businesses?
Yeah, thank you, Councillor Groves. And through you, Mr. Chair, I would imagine that this would be directed to their provincial representatives to bring back to the decisions that are being taken by the Premier in conjunction with the Ministry of Health and the Chief Medical Officer of Health. I certainly have my perspective on martial arts, but I don't have enough evidence and specific aspects of which martial arts or how to be able to comment on it today. But I think ultimately the decision and the jurisdiction around that would sit with the province, and then any decision that's taken is something that we would study carefully here on the Region of Peel.
Okay, thank you very much, Dr. Lowe, and thank you for all your efforts throughout this very challenging times. Thank you.
Thank you, Councillor Raz.
Thank you very much, Mr. Chair, and thank you, Dr. Lowe, for your presentation and all the questioners before who asked some of my questions. I'm going to change the channel slightly to something a little bit more positive. In terms of school acknowledgements for the class of 2020, could you have a recommendation how they can celebrate, whether it's a line of cars and teachers appropriately spaced at the school at certain times? Can you give some advice for people wanting to celebrate but knowing that they have to maintain social distance?
Thank you so much for the question, Councillor Raz, and through you, Mr. Chair. This actually landed on my desk today as a colleague in Niagara actually reached out to me and said, hey, we got to recognize the class of 2020. So it is something we're actively looking at, and I hope to be able to have some guidance and guidelines in the near future.
Thank you very much. That's it. Thank you.
Thank you, Councillor Dasco.
Thank you, and through the chair, and thanks for all of your presentation and your sage advice to us. I just wanted to, I guess, just go back and just get a little bit more clarity on the area-specific numbers or specific numbers that people have been asking about. And you're of the belief that this might be ready for us in a matter of, I guess, days. Is that correct?
So yes, through you, Mr. Chair, to Councillor Dasco, we are basically tomorrow we're going to start issuing a static a map that shows various locations where there have been higher reported numbers of COVID-19 cases, and then we are hoping probably in the week in the next week at least to finish the exploring around the technology solutions and figure out what Toronto and Ottawa did to see how we can move that more interactively onto our website.
Okay, that's great to know, and also I share some of the other concerns that some of my colleagues have brought up too, because those particular pockets don't tell the full story. I must say that this past weekend down along the waterfront in Port Credit and through Lakeview in Mississauga, we had a tremendous amount of people down there that some were showing some social distancing measures and some precautions. A lot of others were not. And I had an opportunity when I went out to go check on garbage and things like this. It was everywhere. I asked folks where they were from, and most were not local. We had people from all over Peel Region. So, it's great to see some of these numbers just for our own edification, but at the same time, it doesn't tell the full story. But what I would also ask is if you might be able to put out some messaging, just reminding people of the importance of staying local and staying home, because as the weather is getting better, I think that might be getting lost, and people might think that it was good a few weeks ago, but it's not necessarily pertinent now. So if you're able to do some of that messaging, that would be great. And then my last point I thought I would just bring up is with regards to cooling centers for some of the regional facilities. I mentioned this. I've heard from the Compass in my area and a few other spots, and I'm just wondering if there's been any attention given towards some of the cooling areas. Thank you.
So you. Thank you, Councillor Dasco, and through you, Mr. Chair. Just to answer to the last question first, in terms of cooling centers, we do recognize that this is a very difficult summer in respect of opening cooling centers, because many of the traditional places that we would advise people to go are unfortunately closed. We would typically say things like libraries, shopping centers, etc. And so we continue to work with our municipal counterparts to identify alternatives at this point in time. But you know, and certainly those will be communicated as they become available. But it's something that we're acutely aware of, and we do recognize, especially with I mean, it seems that summer has come somewhat early this year, which is a good thing most years, maybe not such a great thing this year. But in general, it's something that we're actively looking at, and we'll communicate once it's available. In respect of your other question around indicators, as you've all heard, as you've all heard me say in public a number of times, our goal is to ensure that people understand that we don't want to see scenic hotspots become viral hotspots, and that is the message that we've been trying to deliver around this. I think the key message is people should get outside, but they need to stay local as much as possible, use amenities in their areas. And I would also say that in terms of the geographic data that I've spoken to, this really speaks to the challenge of identifying where people may be getting exposed rather than where people who have COVID-19 are residing, essentially. And one possible indicator that we may be exploring adding to the framework in the future, but we're just trying to see how it works and where it is mobility indicators. So as you all know, Google has a number of mobility indicators that they've used to sort of look at what is the nature of mobility within a community and where people tend to be frequenting. And they've actually had some really interesting numbers, just sort of seeing how it's gone from at baseline to, you know, significantly below baseline on things like transit or in things like offices. But we're trying to figure out how that indicator would perform and help to inform our recommendations and our advice. And I think that would, if anything, be another important piece of the puzzle in addition to the geographic mapping data that we're aiming to provide.
Thank you, Dr. Lowe. I agree. I don't think that it can be said in terms of getting that message or reminding. Thank you.
Thank you. Councillor Downey.
Thank you, through you, Chair, to Dr. Lowe. Really great conversation. And I wanted to touch on Councillor Raz's points regarding class acknowledgement. I've had a couple of requests on the same topic. And I want to point out that in Germany, the IKEA is lending their parking lots for things like large gatherings where people can keep adequate space. So I thought that was interesting, and I'm sure that we can probably get ideas in the field to address those issues. Secondly, my main point is regarding the mapping. I definitely have some concerns regarding the mapping and the potential for stigma related to specific neighborhoods. I support the transparency of having that mapping out because I think that it can help us do better within our communities. And I would like to raise that issue of the disparity in the cases and the heat mapping at our dear committee as well moving forward. Thank you.
So through you, Mr. Chair, and if I may respond to Councillor Downey, absolutely agree on the concerns around mapping. And again, I think my goal would be to make sure that we are messaging it that this is reflective not of the neighborhoods in and of themselves, and not necessarily through any fault of their own, but really that there are a confluence of factors that will explain the picture that we have here and the reason why we need to continue advancing health equity and equity overall in our community. So I think that will be some of the context and story that we hope to provide with any sort of geographic data that is released.
Thank you, Dr. Lowe.
Thank you. Mayor Brown.
I wanted to say, hopefully everyone can hear me okay. Dr. Lowe, there's been a lot of attention over the heat map that Toronto shared. And I know you mentioned that we're going to be sharing similar data. So my first question is, will that be on the website today? And how will that heat map evolve? I know there's going to be one version that comes out today, but it may be more detailed next week. Could you let everyone know?
Thank you, Mayor Brown, for the question, Mr. Chair. In fact, it will actually come out as part of the epidemiologic update, which will be released tomorrow. And I know that there is a lot of interest naturally, but we want to make sure that we get this absolutely right and also make sure that we have the explanation of context right. So we will be releasing it tomorrow with the weekly epidemiologic update. In respect of evolution, the static map will be updated within the update until such time that we actually have an interactive map that would look similar to Ottawa or Toronto's maps that are currently.
And how long do you think that's going to be before we can have that that map up on the website? Because I know I'm getting lots and lots of questions from people wondering when we're going to have that map up. And given the fact that Ottawa and Toronto has done it and they provide that level of transparency, I don't think we have a lot of breathing room to delay. What do you believe is the quickest possible we could get that map on the website?
Thanks, Mayor Brown. As I mentioned, I think we're actively looking into this right now. I know my team met about this yesterday evening, and I can get a firmer update, which I'd be happy to share with your office and with all of regional council afterwards. But I understand that this is meant to be happening in very short order.
Okay. Well, I just stress the sooner the better. There's a high level of expectation on that, and I'm sure other members of regional council are hearing the same thing. And I believe the public, as much as we don't want to create a stigma for any neighborhood, the public aren't children, and they have the ability to digest this in a mature way, and hopefully it will cause people to be more careful and take your advice more seriously.
Thank you, Councillor. Yeah. Oh, sorry. Go ahead, Dr. Lowe.
Sorry, through you, Mr. Chair, and thank you, Mayor Brown. I agree, and certainly we want to make sure that people are taking sort of the broad advice to ensure that they are physically distancing and performing hand hygiene and taking all the reasonable precautions to avoid crowds and wear a non-medical mask throughout our community at this time, recognizing that that it's very mobile. And I think one of the challenges that I've heard, at least in other jurisdictions around the world, or at least identified in other jurisdictions around the world, is that it can also give a bit of a false sense of security. So in respect of, as you said, trying to make sure that our advice and our recommendations are adhered to, that will definitely go into the messaging that is provided. But I certainly agree with you that we do need to move on this, and we need to be able to do it in a manner that certainly I don't believe the public are children, but make sure that it addresses their concerns while not raising others. So thank you very much.
Thank you. Councillor Sato.
Thank you, Mr. Chairman, and thank you, Dr. Lowe, again for being here. I won't ask the questions I asked yesterday. You answered them quite well, but Councillor Dasco asked my question about the cooling centers. It's good that the heat warning has been concluded as of today, but we do expect that we will probably have more, and our staff at the city are looking into how we can provide those going forward. And hopefully they can get advice from you as to how we could manage that. With regard to the testing centers, do we have any control over where they are located, or is that determined by the province?
So thank you, Councillor Sato. In general, they have been led through Ontario Health and with our hospital partners at this time, but there is opportunity, and I know that I've spoken with CEOs of both hospitals, that should we choose to, we can engage to help deliver some aspect of testing centers. It's not clear to me how that would work, and just given the delineation responsibility that's been described so far, but it's an ongoing point of conversation, certainly at our 5:30 p.m. Mayor's calls, and also in my conversations with the CEOs of the hospitals. And so as we continue to see increasing interest in testing throughout the region of Peel, we are going to continue exploring, as I mentioned, with our healthcare partners, all the different modalities that be available, so whether it's mobile testing or private
Okay. Sorry, I guess the reason I was asking is I had a couple of residents complain basically that they had gone down to Credit Valley for testing because they felt they could have been exposed. And their main complaint was the length of time they had to wait, which was over an hour, and the fact that they had to pay $12 parking at Credit Valley Hospital during the time that they were waiting. And the comment was that, you know, the province is telling us to go and get tested, and then we're getting hit with hospital parking fees along with long delays. That was why I was asking if we had any control over that. Perhaps it's something that could be raised at the 5 o'clock meeting. We don't want to discourage people. We always have complaints about the hospital parking anyway, but you know, I think there will be some people who would be put off and not go and get tested simply because they don't want to have to pay a fee. And if they hear that they're going to be waiting for an hour and a half, that could be a very negative. So you don't need to give me an answer on that today, but if you could perhaps look into that. Also, do we have the capacity? We're talking at the city about getting our frontline staff, all of our staff tested. And then I heard you, I can't remember if it was in an email or if you'd made a comment the other day that to not flood the testing centers with all of the staff at one time, that the capacity for testing wasn't there. Could you speak to that, please?
Yes, thank you, Councillor Sato, and through you, Mr. Chair. So on the topic of the parking and access to the hospital, I'm happy for our hospital partners to discuss, and certainly also for, well, if anything, I think to the second question I identified, which is we're really trying to ensure at this point in time that
sorry, you're cutting out.
Oh, sorry. Can you hear me?
Yeah,
Okay.
you keep cutting out.
Oh, I'm sorry about that. I'll try, and if need be, I can always try to reconnect to the meeting. Sorry, I'm just getting a text from. Oh, here we go. Yeah. Hello, can you hear me?
Yes. Yeah.
Okay, great, perfect. Thank you. My apologies. Again, through you, Mr. Chair, going back to the question around how we're getting testing. This is actually one of the main reasons why I'm really hoping that the provincial testing strategy will come out shortly, because it will help us, at least in a more systematic way, to guide people through to testing, and also how we can inform and help workplaces and employers, people who are at certain risk groups, to figure out how we can actually go through that. As I've stated, I think from a public health perspective, our priority right now is really the symptomatic people who may have COVID. They absolutely should be tested to make sure that we are addressing those if they are symptomatic. And then also asymptomatic contacts for, you know, the reason that they're connected to those individuals. And then really the third group, which is asymptomatic people who are at high risk. That is something that I hope will be explained a bit further in the strategy that will allow us to figure out in the region of Peel, where we have many people who may meet that definition, how we actually put that together. So I imagine the provincial testing strategy will hopefully relieve many of those questions, and at least provide a bit of a roadmap on the go.
Okay, so I would assume then that at the 5 o'clock briefings that that you have with the mayors and CAOs, that issue of our staff testing is we don't want. I mean, we want our frontline staff who could be at risk to be tested, of course, but we also don't want to flood the system. So I think we all need to be very careful and take our advice from you. So I look forward to seeing that information coming forward, because I know our CAO was holding off because of messages that seemed to be coming from your office that it wasn't prudent to go and do it en masse at this point in time.
Yeah, so through you, Mr. Chair, thank you, Councillor Sato. Yes, I think that's where I had landed, just recognizing that following the recent provincial announcements over the weekend around testing, our assessment centers have seen significant volumes. And also knowing that the testing strategy and the discussions that have been occurring have really talked about other modalities for testing that may include mobile testing, as well as, you know, primary care physicians, as well as other aspects of partnering with workplaces. So I think once there's a clarity of what's available and on the table on Ontario Health, and further to Madam Mayor's comments in her earlier questions on how this is getting funded and resourced, I will be in a much better position to share just how we might look at getting frontline workers in municipalities, as well as in other settings and sectors, tested to make sure that it's all in keeping with the provincial criteria that have been outlined.
Wonderful. Thank you very much.
Thank you,
Mr. Chair.
Thank you, and Councillor Groves. Councillor Groves, I still see you on my list.
Mr. Chair, sorry, I just forgot to take my hand down.
Very good. Okay. Thank you.
Thank you.
So that concludes an excellent presentation and some excellent questioning. Thank you, Dr. Lowe. Now, next up is Andrew Farr, item 8.3, an update regarding waste management during COVID-19 emergency declaration. Andrew.
Thank you, Chair. Good afternoon, councillors. For today's waste management update, I'd like to focus on the community recycling centers. You'll have read in our biweekly update that our waste management services, for the most part, continue to achieve our desired level of service, which is good. Like you, our collective goal continues to be assisting the community during the challenges of the pandemic so that they aren't worrying about their garbage. You'll also note we are proposing to begin charging for large loads to help manage congestion and lineups at the sites. To give you some context, in the last 2 weeks, we are seeing numbers far beyond the previous 3-year average, both in number of users and tonnage. And we're seeing traffic counts on weekdays that we would normally see on weekends. This Tuesday, we saw an increase of almost 900 visitors, or 75%, over the same day last year. While we waived fees so our typical residential customers would have reasonable disposal options, some non-residential users at the CRCs are significantly impacting wait times, traffic on surrounding streets, and operations. To maintain our goal while lessening the number of large, heavy loads, we suggest implementing a 100 kilogram per load or per day limit for the waived fees. Visitors can still drop off all the material above the limit, but will be charged our standard fees for anything over 100 kilograms. Residents visiting the Caledon CRC will still be allowed to drop off their usual 150 kilogram per day of yard waste. We expect this will help space out larger loads across multiple days, encourage residents to keep non-essential items at home, and create an improved experience for the majority of our residential users. As Councillor Sato mentioned at the outset of today's meeting, I've also received questions this week related to the ongoing suspension of bulky items. This decision, along with the suspension of curbside collection of bulky items, was made early in our COVID response to protect the health and safety of our staff and contractors. As you can imagine, compared to lifting garbage or yard waste bags by hand, the lifting of heavy furniture and other large items leads to multiple points of contact on the body. At the CRCs, the unloading of bulky items also takes a little longer and contributes to longer than usual lineups. However, as part of our evolving plan, we are proposing a path forward which will increase our service level to residents. Assuming the fee charge we're recommending today results in positive impacts on wait times and lineups at the CRCs, we will next be able to start receiving bulky items. We suggest monitoring the impacts over the first couple of weeks with the intent to begin receipt of bulky items again in mid-June. Assuming people are also being reasonable in what they bring to the CRCs, I would suspect most bulky item loads will remain free of charge. By creating the space for cars and residents, we can allow residents to unload their bulky items themselves, which improves the level of service without adding any risk to our staff. My last update relates to the collection of bulky items at the curb. As we wind down what has been a very heavy weekly yard waste collection season in June, we are reviewing the return of bulky item collection at the curb. Pending discussion with our contractors, we anticipate this service will return early in July, or as early as June 29th, but potentially early July. Thank you, and we're happy to answer any questions you may have.
Thank you. Councillor Sato.
Yes, thank you, Andrew. And thank you for covering all of the items. I appreciate the phone call as well to discuss the issues. So what is the fee? Sorry, I'm having trouble getting my report back up again. It went down. What is the fee that you're proposing then for the larger larger loads that are coming in? And at what point is it a cutoff?
So right now, we're not charging anything for anything anyone.
No, I know the proposed for those big ones that you said are taking advantage of the free.
It would be 11.8 cents per kilogram. So for every extra 100 kilograms, so 220 pounds, which is quite a lot. That's a full car or van load. It'd be $12. So the first 100 would still be free.
The which would be free? Sorry.
The first 100 would still be free. Any recyclable materials, metals, or anything else would also be free, regardless of the volume.
Okay, so basically, if a resident brought, let's say, a couple of garbage bags or some personal renovation material, lumber, things like that, they would probably still fall under the free category.
You're correct.
Okay, so if it fits in a small car or a van, it's probably okay. If it's these big truckloads, it's not.
Correct. Just for context, we're seeing some loads that are in the range of 1,000 kilograms or more.
Yeah.
People are bringing in literally a ton of material.
Yeah. So I mean, those are contractors, obviously, that are doing that. Yeah, I think that's very fair because then it's going to allow our residents to be able to bring in their large items and hopefully then I guess that would be within about 2 weeks you expect.
Yes.
Since we're almost into June.
Yes, we would start the fees a week from Monday to give us time to communicate it. We want to give anyone that has their last chance to get in the free period will be able to get it in. And we don't want any confusion in the lineup. So that gives us a little bit of time to communicate. Then we'll give it a little bit of time just to make sure the lines dissipate. And then we would look at bringing bulky items back.
Okay, and I know that you are getting long lineups at the Battleford CRC, and having to bring in off-duty police officers because the lineup at that one in particular is on the roadway to control that traffic. So it certainly is an issue. I think it's good news that we can tell residents they can look forward to the beginning of July, hopefully. If the contractor's okay with it, to put it out at the curb. So those larger things that don't fit in a car. But I think just giving them the opportunity to take it to the CRC is good. I mean, right now, as you know, we do have people that are putting it out. I don't know why they haven't gotten the message yet because I've personally seen the stickers on the items that are left out and I don't know how people can miss it. But they're not pulling it back in. So I guess they figure there's a garbage fairy that's going to come and clean up their mess. Even though it's been there for 2 weeks, I guess they're just not getting the message or they're posing their own little rebellion against the rules. So I guess, Mr. Chair, there would be a motion then for the charge for the fee and for proceeding, and I would be more than pleased to move that. I think it's a good way to move forward, and thank you, Andrew, for following up on this for us.
Thank you. Councillor Groves.
Thank you, Mr. Chair. Thank you, Andrew, for your update. I guess I just have a couple of questions, and my residents, they continue to be concerned about the grass clippings and that not being picked up. And are we looking, Andrew, at revisiting this at any time, or is that it for it? That's a final decision that we will not be collecting the grass clippings anymore.
So thanks for your question. Through the chair, you'll recall that, so this came through as part of our 2020 budget, and several months ago, we did have a debate at council and revisit it. And the end result that we have as staff is we have proceeded as if this is the program that we are delivering. We don't have any plans to revisit. At council's discretion, we could revisit at any time, but at this point, we are not planning to.
Okay. So can you just to clarify for me, yard waste and that we can still, the residents can still bring it to the CRCs, correct?
You are correct. And for those areas in rural Caledon that don't receive yard waste pickup, they can bring it to the CRCs free of charge, whether we're charging fees or not.
All right. Okay. Thank you very much.
Thank you. Councillor Dasco.
Thank you through the chair. I just wanted to have a few points of clarification because Councillor Sato actually asked a bunch of my questions as well, which was great. I think we're on a similar page. My question was just with regards to duration on that. How long is this program to be in place? Is this for the length of the state of emergency?
Yes, Councillor, we're still working on, as Nancy mentioned at the very beginning of the meeting today, we're still working and refining our recovery plan, but it would be our intent.
Sorry, Andrew, you've frozen on us if you can hear from me. Andrew, if you could start the answer again, if you can hear me, because you're there. I think you're back. Go ahead, Andrew.
Right, thank you. My entire screen went blank as well, so I assume you didn't hear me either. So yes, you're correct, Councillor Dasco. As our recovery plan rolls out, as the state of emergency winds down, we will slowly bring back our services back to normal over the summer and into the fall.
Okay, thank you very much.
Thank you, and Councillor Demerla.
Thank you, Chair. So, Andrew, I think Councillor Sato's question sort of clarified, but I just want to make sure that I understand this correctly. Because at this point, we are not collecting large items. I thought Councillor Sato said that most reasonable large items would still fall under the 100-kilogram limit. And so we're not doubly penalizing them in the interim period. I just want to make sure that if someone has household stuff, usual stuff, I don't know, the odd armchair or stuff like that, that they want to get rid of, they go to CRC. Presumably it's under 100 kilos and it's still free. And then in 3 weeks, I guess, and they can just leave it at the curb. Would that be a fair assessment?
No, not quite right.
Okay, so I'm glad I asked them.
Okay, yes, thank you very much for the question. I'm glad you did. So through the chair. So right now, we will accept an unlimited amount in terms of weight. However, we're looking for things in garbage bags, not bulky items. So not big chairs, not bookcases, things like that. Within a few weeks, assuming we can get the lines down at the CRCs, we will start accepting bulky items. So that's your really big items, things that take a couple people to lift, furniture, things like that. So within, I would say 3 weeks, we will be accepting those at the CRCs. It would be our plan for end of June, early in July, to start collecting that at the curb.
But in the interim, they can still drop it off at CRC.
No, we're not accepting bulky items right now at the CRC. We're accepting items in bags and things like that. Okay. Things that can be picked up without touching it with one hand.
Okay. So my second question is actually along what Councillor Groves asked. I'm starting to get, I guess people are realizing the grass clipping issue more and more. One very interesting question that's come up is this lady who says she's got allergies. So she's framing it as a health issue. She did get an exemption, which would allow her to take the clippings, I guess, to the recycling center. But what she's saying to me is, for me to even put the grass clippings into my car and go is a health issue because, you know, the allergens will be all in the car. I see Councillor Sato smiling, but I'm just saying, you know, I'm just telling you what my constituent has said, and she's framing it quite significantly as a health issue. And I'm just trying to understand, is there anything else we can do for people who may have these kinds of, who may frame this as a health issue, and what are the options other than, of course, carting it in your car to a center?
Okay, thank you for the question. Through the chair, That question, we've been dealing at the same speed, and I do know which resident you're speaking of. That caught us a little bit off guard, and we are working through some options. I'd be happy to bring back some information to council, maybe in my next update or the one after that. I can't make any commitment that we have an option that will be appeasable to everybody, but let me certainly bring back information of what we figured out and what we have in front of us.
Thank you.
Thank you, Madam Clerk. That exhausts my list. What other direction do you need?
Don't believe any motions are necessary coming out of the discussion today. Council will recall that there is a general resolution that was passed authorizing the Commissioner of Public Works to adjust the waste management services as necessary. So coming out of the discussion today, and given the timing of some of the items that Commissioner Farr was discussing, I don't believe that any motion is necessary from today's discussion.
So the conversation's taken as direction and carry on. Thank you. Okay, that brings me to item 10, staff presentations. Item 10.1, improving housing subsidy administration. A presentation by Grace Canon, Program Director, Service Transformation. Grace. And Grace, I see you on my screen all good to go, but I'm not hearing you yet, so over to you.
Do you hear me?
There
now?
we are. Now we've got you.
Oh, perfect.
Carry
Thank
on,
you.
Grace. Carry on.
Thank you. Good afternoon, everybody, Chair and members of Council. I'm very happy to be joining you today. Next slide, please. I appreciate the opportunity to provide some context to the report because today we were proposing a significant change in the way we administer housing subsidies. Next slide. The report before you is the second in a series of reports on service transformation, one of the strategies within Peel's 10-year housing and homelessness plan. The 5 strategies work together to achieve the outcomes of the plan. The outcomes, which are in the dark blue circle on the slide: affordable housing is available to all Peel residents and homelessness in Peel is prevented. The first report on service transformation was tabled in November of 2019. At that time, Council was informed of a proposed philosophical shift to a needs-based approach to service delivery, as well as a mandated requirement to implement a coordinated access system for the homeless. Today, we are seeking Council approval to apply that needs-based approach to how we administer housing subsidies. Next slide, please. Currently, there are different types of subsidies available in Peel. Some subsidies are attached to a unit in a community housing system. Some are attached to a unit in private landlord buildings. Sometimes the subsidy is given to clients and is therefore portable, meaning that the subsidy moves with the client. 11,456 households in Peel are supported with a housing subsidy, and all of these subsidies were administered using the centralized wait list. What's important to note is that the Housing Services Act requires the region, as the service manager, to provide 8,424 subsidized housing units in Peel. This requirement to use the centralized wait list extends only to the 8,424 subsidies. Council is well aware of the challenges associated with the wait list. Wait times are long, and the requirement to move through the wait list chronologically prevents us many times from being able to provide timely assistance to clients with the most complex or urgent needs. The current approach also prevents us from tailoring solutions to our collective client needs of both low, medium, and high needs. Managing the wait list is administratively burdensome also. Next slide, please. Staff is therefore seeking Council's approval to start to shift away from using the centralized wait list where we have the flexibility to do so. We are recommending that we use the centralized wait list to administer subsidies required to meet the legislated standards of the 8,424 units and to administer all remaining subsidies, approximately $30 million of funding and 27% of the total subsidies, through a needs-based approach. I want to emphasize that a needs-based approach doesn't mean that only our clients with the most complex needs, the chronically homeless, will qualify for subsidy. Our proposed approach is about understanding what our clients need in order to become stably housed and using that information to create case plans tailored to our unique client circumstances. So while a shift to a needs-based approach will help us house clients with complex needs faster, it will also help us administer the right type of subsidy to clients with short and medium-term housing needs. Today, all clients sit on the centralized wait list, and when their turn comes up, they get the same offering, a subsidy or a unit with no end date. It might just be that they require short-term assistance to help them through a difficult period of time, and this will allow us to do that. In sum, our needs-based approach is about providing the right level and mix of supports to our clients to help them get and keep the housing they need and can afford. Next slide, please. We anticipate that the proposed changes will improve housing stability for our clients and provide timelier access to subsidies for those with urgent needs. We also anticipate that these changes can enhance the impact of housing subsidies by approximately 20%, increasing our reach with the same investment. Finally, these changes will help ease the growing pressures in the shelter system. This benefit has already been started to materialize through the pandemic as the emergency created the urgent need to prioritize families in the shelter system for permanent housing in order to prevent the spread of the virus amongst this vulnerable population. Because we were fortunate to have private landlords offering us new housing supply, we were able to make these timely decisions. Next slide, please. I understand that a significant shift such as this brings about many questions as to how this new approach will be operationalized. Because this is a change in philosophy, staff are taking a measured approach moving forward. Should Council approve our recommendations, we will work to ensure that the new approach has the appropriate controls in place to achieve the intended outcomes. Staff will finalize those program details and complete the transition plan. If approved, we will return to Council prior to implementation to ensure you have all the information that you need to understand the change and communicate it as needed to your residents. Once implemented, we will evaluate the results and report back to you before the end of 2022. Next slide, please. Thank you for your time today, and I'm pleased to answer any questions that you may have.
Thank you. Councillor Demerla, Dasco, and Groves, you're still on my list, but I don't know if it's from the previous session.
I'm on to speak to this, Mr. Chair.
That is Councillor Demerla?
No, this is Councillor Groves.
Yes, you're third, though. So Councillor Demerla, I assume, is very good. You've become number one, Councillor Groves. Go ahead.
Thank you, Mr. Chair. Grace, thank you for the presentation. And I think this is wonderful. It's good news. Sometimes we need to move away from what was old and sort of look at what is new because times are changing, needs are changing. And I can tell you that with this pandemic, there are many people that are struggling right now. And I think when this is all said and done, we're going to see a greater need in the community, in certain communities, for people needing subsidies. So I thank you for bringing this forward, Mr. Chair. I don't know, this is just a presentation. I don't know if there's a motion or you require anything to move this forward, but if you do, I'm happy to do so.
And I do, and you've just moved the motion. Thank you. Councillor Dasco.
Thank you through the chair, and I appreciate the presentation. I just wanted to ask, it looks quite interesting, but I'm not an expert in the field. I just wanted to ask if there's been consultation done with those that you would be working through to provide the service.
Yes, thank you. Thank you for the question, Councillor Dasco, and through you, Chair. As part of our service transformation experience, we've had extensive consultations. We're partnered with Peel Alliance. We've sought out throughout for this last year to consult with those with lived experience, users of the programs, and all community partners, as well as other levels of government. We've made sure that we've made those connections and received that information to inform our next steps and our plans going forward.
Okay, thanks, Grace. Much appreciated.
Thank you. And with that, it's been moved by Councillor Groves and Councillor Dasco. Madam Clerk.
That the Region of Peel adopt a needs-based approach to administering housing subsidies as described in the report of the Commissioner of Human Services titled Improving Housing Subsidy Administration. And further, that the centralized waitlist be used to only administer housing subsidies required to meet the legislated service level standard under the Housing Services Act 2011. Call the vote. Mayor Brown. Mayor Brown. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
Yes.
Mayor Crombie in favor. Councillor Demurla.
Yes.
Councillor Demurla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon.
Yes.
Councillor Dillon in favor. Councillor Downey. Councillor Downey. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini. Councillor Fortini. Councillor Groves.
Yes, in favor.
Councillor Groves in favor. Councillor Innes.
Yes.
Councillor Innes in favor. Councillor Kovac.
Yes, in favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros.
And Mayor Brown's in favor if you didn't hear me.
Thank you, Mayor Brown. Councillor Medeiros in favor. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sado.
Yes.
Councillor Sado in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor?
Councillor Sinclair in favor. Councillor Starr.
Yes.
Councillor Starr in favor. Mayor Thompson has left the meeting. Councillor Vicente.
Yes.
Councillor Vicente in favor. Carries. Thank you.
Thank you all. That brings me to item 15, items related to planning and growth management. 15.1, new provincial policy statement 2020. Councillor Sinclair, you asked that this be held? Councillor Sinclair, I think you're still muted. You have the floor. If you could unmute yourself, please proceed.
Sorry, just a few concerns here. That perhaps I should meet on my own with Peel staff, planning staff to get clarification. But one of the main ones that I noticed was a reference to a study on financial and technical feasibility of proposed communal systems, which in likelihood are all going to occur in Caledon. And I would like to be involved in that study process, please. And the second one is there seemed to be the idea of providing large land supplies for housing in the future. And I wondered what forms of housing, and showing my age, I watched, and I'm from Toronto, something called St. Jamestown at Bloor Parliament in Wellesley being built. And I suspect there's 25,000 people on 50 acres there. So what housing form are we talking about in terms of land supply is an important consideration. So those are my quick points on this. Thank you. I'll move the report if that's acceptable. Thank you.
Thank you. I didn't know if staff wanted to respond to that briefly.
Through you, Mr. Chair, it's Adrian Smith here. Yeah, just a couple of comments. Certainly, the provincial policy change around communal and septic services and what have you is something that we need to review and respond to during our municipal comprehensive review. And as you see, we're going to be initiating a study. So happy to reach out and talk to you about that process. And we'll be reporting further to council on that study as it progresses. And in terms of the provincial land supply, so There is a requirement in the provincial policy statement, as you've seen, for municipalities to maintain supply of land to accommodate housing, but it does include all forms of housing. So it includes lands that are zoned, designated, serviced, and that would include lands that might be accommodating housing through intensification and an infill in existing communities, currently designated greenfield areas and new areas. And as you know, through our housing reports that we've done, the housing work that we've done, we've looked at the needs across the community to accommodate all that various components of the housing continuum. So it incorporates all of that. And through our municipal comprehensive review, we are looking carefully at how all of those components of housing needs are met in the region.
Thank you. Councillor Innes.
Thank you. And just to follow up on Councillor St. Clair's comment, so that was the communal servicing study was one of the things that first jumped out at me. So I guess my first question to staff would be, and I ask this because when they updated the Aggregate Act, as an example, they completely forgot about the Palgrave residential estate area and it being the only estate lots made available in the GTA and that are actually on the Oak Ridges Moraine. And so I want to make sure that I guess one of the questions is, have we clarified from provincial staff that the communal servicing study should actually even include the Palgrave Estates area, given that it is in the Oak Ridges Moraine? As mentioned before, when they did the Aggregate Act, they updated it and allowed for them to actually drill below the water table in the Oak Ridges Moraine for existing applications for being renewed. They didn't realize, because they completely forgot about Palgrave, because it's the only area of its kind in the province. So I want clarification from staff. I think that clarification before we commence any sort of study from the province, whether or not Palgrave is even part of that or should be part of that study, given its unique characteristics.
So through you, Mr. Chairman. So the provincial policy statement is a general document and isn't specific about certain areas. So we'll be looking at setting out a framework for considering kind of the availability, planned feasibility of services from a Peel perspective, and we will definitely be taking into consideration, the specific policy framework that applies to each of the communities around Peel, mostly Caledon, of course, and that history that applies to Palgrave. So that'll all be incorporated into our work, and we won't be sort of starting with a clean slate with that. We'll be taking all that into consideration for sure.
Okay, and just to follow up on that, I think I too, along with Councillor St. Clair, would be very much like to be part of the process. And I'd actually like to even see the terms of the study and insurance that that the region is working in partnership with the town of Caledon, because there are some quite extensive histories in some of the villages and hamlets within Caledon, both in wards 1 and 3, 4.
Yeah, definitely. We have been working with the town, and we do plan on bringing a report to council in the next month or so with some further details on that study. So it'll be an opportunity to do that, and we'll reach out to you as well.
And could I ask that perhaps that actually come to our municipal town council as well, ask the region to come and present, because it does impact so many villages and hamlets within our municipality that I think that it would be important information to be shared with our area councillors as well. Thank you.
Thank you, Councillor Dasko.
My apologies. I need to take my hand down. Thanks.
Thank you. With that's been dealt with, and all of that discussion taken as direction, bringing me down to item 18, communications from Trevor Wilcox, Secretary Treasurer, Association of Municipalities of Ontario, dated April 28th, requesting nominations to the 2020-2022 AMO Board of Directors. And I need direction because I think we're entitled to an additional seat. Madam Clerk?
That is correct. Previously, Mayor Thompson had been appointed until 2020, but there is a opportunity to nominate a councillor to the AMO board. So open to receive any nominations from the councillors.
Could I just have a point of order and ask if does this mean that Mayor Thompson's seat is completed, or is his until the end of 2020?
Mayor Thompson is actually still on the board as the AMO rep, so he is still there on the board. This is a call for nominations starting for 2020 and requires a new nomination. It's vacant at this point.
Councillor Vicente here.
Yes, Councillor Vicente.
I'd be happy to advance my name for consideration.
Very good. Can someone?
I'll second that for Councillor Vicente.
Okay, Madam Clerk.
Councillor Groves.
Councillor Groves has seconded it. Madam Clerk, is that appropriate for your purposes? Then over for the vote to you.
Thank you. Motion by Councillor Vicente, seconded by Councillor Groves. Whereas the Association of Municipalities of Ontario, AMO, in accordance with the governing bylaw regarding the election of the AMO Board of Directors, requires that qualified nominees submit a council resolution of support that specifies one of AMO's named caucuses prior to close of nominations. Therefore, be it resolved that Councillor Vicente be nominated as the Region of Peel representative of the regional and single-tier caucus directors for the term 2020 to 2022. Taking the vote, Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
I support.
Mayor Crombie in favor. Councillor Demerla.
Yes.
Councillor Demerla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon. Councillor Dillon. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Dillon here, it's yes.
Thank you, Councillor
Yes.
Dillon. Councillor Fortini in favor.
Yes.
Councillor Groves.
Yes.
Councillor Groves in favor. Councillor Innes.
Yes.
Councillor Innes in favor. Councillor Kovac.
Yes.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
In favor.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Raz.
Yes, and thank you to Councillor Vicente for putting his name forward.
Thank you, Councillor Raz. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes, way to go, partner.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
Yes.
Councillor Starr in favor. Mayor Thompson is absent. Councillor Vicente.
Yes.
Councillor
Thank you.
Vicente in favor. It's unanimous. Carried. Thank you.
Unanimous and with congratulations. Okay, bringing me down to item 21, other business councillor inquiries. And as number one, as acknowledged earlier, I have Councillor Sato regarding council meetings and procedures moving forward. Councillor Sato, your inquiry.
Yeah. Thank you, Mr. Chair. Yeah, I was just wondering if maybe at the next council meeting, I guess it would be second week of June is our next meeting. I haven't looked at my calendar. If Catherine could bring back a recommendation for us scheduling of meetings going forward. I think it's been very helpful for us to be meeting to get the COVID updates, and as things are changing, I would prefer not to see us going into our usual summer schedule. I think at the city we're probably going to be looking at July every other week instead of every week. I know we're going to be discussing that I think next week at council. But I'd like to suggest that we continue to meet. I don't think many of us are going to be going anywhere for vacation, although I think people will need time off just away from Webex. So just a request, Mr. Chair, to bring it forward and have a discussion next week.
And Councillor Sato appropriately put, the chair had the same thought and thought it was something we could discuss in June to see what the consensus was around the table. So to be dealt with in June, and we'll probably have more insights on what you folks are doing locally by then. Okay.
Right.
Anybody, sorry, Pat, anything further? Okay. Anybody else? Any other inquiries or council business? Then I will report back on one, and ironically, it relates to Councillor Sato as well. Remember at the last meeting, there was a request or a consideration that our friends at the Police Services Board and the Chief be mindful of tough budget times coming forward. And Councillor Sato, you also mentioned with regards to the excessive speed racing that was going on. I had opportunity to speak to the Chief and raised both, and he informally would be happy to come and speak to us on both those matters. Though I might tell you, you may have noticed there's been a considerable uptick in our enforcement of street racing and those types of things that you may have heard of. But what I did want to do is tomorrow at our board meeting of the Police Services Board to officially refer to my colleagues as well, because of course I cannot direct the chief to do anything, and I wanted my colleagues to be aware of it at the board. I think the chief is very sympathetic to the request to come see us in June electronically and tell him what the state of affairs are, and I'm hoping my board sees the merit in that, and so I will be introducing that to them tomorrow as well. And Pat, I wanted to give you those updates. Okay, does anybody else have any other inquiries or council business? If not, Madam Clerk, I think that brings me down to you. We're on to
sorry,
the...
Mr. Chair,
Oh, sorry.
I did have my hand up, Mr.
Oh, okay,
Chair.
go ahead, Councillor.
Concerning the street racing, just to look in your text messages, I will be sending you one to bring up at the Police Services Board tomorrow. A resident sent it to me. It shows specifically his license plate, but he's also pointing guns out of his car. So I thought, first of all, he's stupid to be showing his license plate, but I think that this is something that you could give to the chief personally to look into. I have sent it to my police department as well, but I think going right to the board would have a greater impact. So I'll send that to you by text right now, Mr. Chairman.
Thank you, and I will share it with our colleagues tomorrow as well. But I'm glad you, and I hope you and everybody took the immediate first step to refer to the police right away. I'm happy to follow up with the board as well. Councillor Sinclair.
Yes, thank you. Also on street racing, would you consider inviting OPP Inspector Mike Garant from Caledon? We've also experiencing quite a bit of street racing up here. And he and his officers are capturing Ferraris, Maseratis, Porsches, and impounding them. So I think it's a Peel-wide problem, and it might be useful to hear the countryside experience also. Thank you.
Very good. So Ian, perhaps under the same heading of to invite our colleagues from enforcement from Peel Regional and then the OPP in June to come and speak to us about electronically again, the state of affairs and maybe address any questions we might have at that time. I will take that as direction as well. Seeing no one else on my list, Madam Clerk, over to you.
Thank you. We're at bylaws. Resolution moved by Councillor Madero, seconded by Councillor Paleshi, that the bylaw listed on the May 28, 2020 Regional Council agenda, being bylaw 40-2020, be given the required number of readings, taken as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed thereto. Are there any objections? Hearing none, carries. Next, a resolution moved by Councillor Fonseca, seconded by Councillor Carlson, that the bylaw relating to in-camera item 24.2, being bylaw 41-2020, be given the required number of readings, taken as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed thereto. Are there any objections? Hearing none, it carries. Confirming bylaw moved by Councillor Sinclair, seconded by Councillor Demerla, that bylaw 42-2020 to confirm the proceedings of Regional Council at its meeting held on May 28, 2020, and to authorize the execution of documents in accordance with the Regional Appeal bylaws relating thereto, be given the required number of readings, taken as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed thereto. Are there any objections? Hearing none, carries.
And with that, I will acknowledge a motion to adjourn from Councillor Fonseca, seconded by Councillor Paleshi. Assuming no one is in objection, that carries. We stand adjourned, and thank you all. And a shout out to our technical folks. Dare I say, a glitchless technical meeting. So well done to all.